sorry. Good morning. Good morning. We welcome you all to the Newark Church of Christ on this snowy winter morning. Actually, it's not too bad snow out there, but enough to slow people up. We are thankful to be here to this beautiful, I'm going to call it, health workshop that we are in the midst of putting together. We are thankful to God for blessing us. We welcome those who are joining us via YouTube and Facebook, which I would assume would be the vast majority of people just due to the weather we're in. But the most important thing is getting out this health awareness information to those, whether it's in person and or online. We're thankful for God to be able to put this event together throughout this day. And we're going to go on just the same in terms of sharing the information we have from a health standpoint, because we know that it is important to be aware of your health and some of the things that's necessary for you to do from a preventative standpoint, as well as to correct certain situations. We have throughout this day, we have a full line of professionals who are here to share information for both the men and the women throughout this morning into the afternoon. And if you are joining us online and you're hesitant in terms of coming out in person, it's better to be in person. Certainly better to be in person. So come on out and join us. Fortunately, we are recording this as well, so we'll be able to re-show it for those who are not able to join us. We're thankful for all those who are put their hands together in terms of putting this together and organizing this event. This is our first full health workshop that we're doing, and we will certainly continue this throughout the upcoming years as we do this. But before we go any further, we are godly people, and we want to give God his just due. I'm going to ask that you bow with me as we go to God in prayer, giving thanks for this day and this opportunity. Let us pray. Father God, we come to you at this time. Thank you, dear Lord, for all that you have done for us, for your blessings, your mercy, and your grace, for allowing us to see this day, for allowing us, Father God, to have the foresight and the willingness to put this event together, Father God, in reference to our health, our physical health, dear Lord, for we know that we have to take care of ourselves. We have to be smart in reference to how we live, how we eat, how we diet. All those things, Father God, are essential for us to have longevity and health on this earth. Father God, bless those who are on their way, that they may make it here safe and sound without any hurt, harm, or danger being brought upon them. We're prayerful for those who are here, that they will be attentive and receptive to the information that will be provided for them. Father God, we just thank you for the love that you have shown towards us. Bless the speakers, dear Lord, that they may provide the information as simplistic and as clear as possible, that they'll have a clear understanding of what they must do to obtain or maintain their health, dear Lord. For we just love you for all that you do for us. Continue to watch over us and bless us. In Jesus' magnificent and holy name, we lift this prayer. Let all who love the Lord say, amen. So we have slated both men and women sessions, 2 sessions for men and women. Men will be in the overflow next to us, and the women will be in this session here in the main auditorium. For the women, we have Rachel Haley, who will be conducting the mental health mental health section in terms of getting the support you deserve. Rachel is an adjunct professor and director of for criminal justice reform program in New Jersey, and she will give the ladies all the information that they need in reference to pertaining to mental health. And in the overflow, we have Angela Ramos. She is a certified health education specialist for the state of New Jersey here in Newark, and she will be dealing with the mental health for the men in reference to what we need to know regarding mental health. Serious topics that most of us know have been critical for a lot of downfalls or issues and problems. So certainly want to pay close attention and receive as much information as possible regarding these two sessions. So without further ado, I'm going to bring up Sister Mickey Taylor, who will introduce the speaker for the women, and I will do so over in the other side for the men. At this time, Sister Mickey Taylor.
Thank you so much, Brother Wood. Good morning, everyone. As you've heard, we've gathered those who are at the top of their field to share what you need to know to own your health and well-being. Joining us today to discuss mental health is one who, in her private practice, understands the compelling fact that 40% of women are more likely to suffer health concerns, mental health concerns, that is, than men. She leads a team that provides a safe environment where clients can heal from anxiety, depression, all types of trauma, life transition, stress, and more. Won't you please welcome the adjunct professor and director for a criminal justice reform program in New Jersey, Rachel Haley.
Good morning, everyone. That was an awesome introduction. Thank you. So today I will be talking about embracing your mental health. So my name is Rachel, and the letters behind my name I think is good to tell you. So LPC is for Licensed Professional Counselor. So that means that I got my master's degree in counseling, and I'm licensed to practice in New Jersey. And the ACS means I'm able to supervise other counselors. Okay. Next slide, please. All right, so what we're going to be talking about today is what is mental health. We will cover an overview of mental health, Black mental health, trauma, and some myths and facts. And then the second part of what we're going to talk about is what to do about it. So this section will cover how to get help, what help is out there, what resources are in Essex County. I'm just going to do general resources and self-care. Next slide, please. So what is mental health? And so next slide. Oh, yep. Did you know? So we're going to talk about some mental health facts pertaining to African Americans and women. Next slide, please. All right, one more. Yep, keep going, other way. All right, perfect. So the first one is from the Substance Abuse and Mental Health Services Administration in their national report. So in 2021, the National Survey of Drug Use found that 21% of Black and African Americans who had a health concern only 39% of the individuals received mental health services. The next one is, this was a study by the National Institute of Mental Health. So studies also show that African American youth are at risk of developing PTSD. Nearly 65% of African American youth report traumatic experiences compared to 30% of their peers from other ethnic groups. And the third one, specifically, this is referring to attempted suicide in Black women, so from ages 9 to 12, so youth. In 2002, suicide was the third leading cause of death for Black and African Americans ages 10 to 24. The death rate from suicide for Black and African American males was more than 4 times higher than for Black and African American females in 2020. The overall suicide rate for Black and African Americans was 50% lower than that of non-Hispanic and white population. Black and or African American females in grades 9 to 12 were 60% more likely to attempt suicide in 2021 than their non-Hispanic white females of the same age. Black or African Americans living below the poverty level also compared to those over twice the poverty level were twice as likely to report serious psychological distress. So I didn't, and we have one more. And the last one is difficulty finding help. So among adults who received or tried to receive mental health care, Black people, Black adults are 46% are more likely to report difficulty finding a provider who can understand their background and experiences to white counterparts. So I highlighted those not to depress everyone, but just to let everyone know that there is a need for mental health education. There's a need for advocacy. There's a need to know where to get help and to know what we're facing. I think when we face things with honesty and vulnerability, when we face things head on, we're able to know what to do and how to get through it. So next slide, please. So I just wanted to introduce myself so you could get to know me a little bit. We all have mental health, and we will encounter someone who needs mental health services. So this presentation is really to educate you, to empower you so you can embrace this aspect of yourself. I wanted to talk a little bit about what brought me to mental health so you know my story. I grew up in, we're in a church right now. I grew up in a nice Christian family, multiracial. My mom is from Haiti. My father is Italian American. And everything was great up until my teenage years when I experienced some sexual trauma. And at that point, we didn't really talk about it. We didn't know what to do. So I was kind of at a loss as to who I was, what my identity was, who I am after this had happened. So I started, when I went to school and I went to college, I started exploring and figuring it out for myself. And I got therapy for the first time. And it changed me. Understanding who I am, my identity, understanding trauma changed me, and I had answers to questions that I've always needed answers to. So this drew me into the mental health field because I didn't see a lot of people like me. I didn't see a lot of people who understood what it's like to have my cultures and the way that I think, and just understanding what it's like to be a woman, what it's understanding like to be someone in their 20s, just exploring their identity with non-judgment. So I came into the mental health field working through so many different avenues, and then I landed on becoming a counselor because I felt most connected to that. So now, after 12 years of doing this work, I currently am an adjunct professor for Northwestern University, helping other counseling students. And then I am a director at the Mental Health Association in Criminal Justice Reform. We work at a Essex County Correctional Facility and in West Orange, and we give therapy and all different resources to individuals who are coming out of Essex County Correctional who need the support. And then also I do senior therapy as well. I run that program where we offer therapy to anyone who's 60 and older in their homes. So these are vital programs that I think bring a lifetime to many people through the lifespan. So I just wanted to talk about that just so you can see where I'm coming from and my mindset with this conversation. All right, next slide, please. So I just wanted to define for all of us what mental health is. So this is a definition from the CDC, which I really like. We all have mental health, just like physical health. The CDC defines mental health as our emotional, psychological, and social well-being. It affects how we think, how we feel, and how we act. It also helps determine how we handle stress, how we relate to others, and make healthy choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. So just so we have a clear definition of what we're talking about today, let's go on to the next slide. So I wanted to talk about this art piece because I like to use all different creativity in talking about mental health. And this is a piece by Kirsty Latoya, and it's called Drowning in Emotion. So I think that I know for myself, I know what it feels like to feel like I'm drowning and not know what to do. And sometimes we don't even have words to connect to the emotions we're feeling, but we're feeling it. So we sometimes feel it in our bodies, in our chest, in our necks and shoulders and arms. We feel heaviness. Sometimes we feel it. Sometimes we can cry, or sometimes we can't cry at all. Sometimes we're angry. We don't know why. So I wanted to highlight this art piece in talking about mental health concerns of Black women. So number one, as we talked about in some of the statistics, was proper health care and access, right? Understanding when to get help and how to get it. So we're going to talk a little bit more in the second half of this about what you have access to in Essex County and what things to do. But that's also a concern, is like everyone needs to know what to do, right? Stigma, right? Getting treatment, being judged. Like some people have stigma around medication, stigma around going to therapy or asking those kind of questions, right? And then the understanding of like, what is a mental illness as opposed to just taking care of your mental health. Anxiety and depression and PTSD, post-traumatic stress disorder, is really prevalent in the Black community. So, and PTSD can be connected to trauma, but can also be connected to racism and violence. So those are some of the things. And then the last thing is trauma. I didn't want to forget that one, that it can get passed down through generations. It could be something that you experience, and it could be oppression over a period of time. So trauma is also part of some of the experiences, and everyone has a different reaction to trauma. And we're going to go into trauma now and talk about that a little bit, just so that we have an understanding of what that is. Because sometimes when we talk about mental health, there's all these like clinical words that get popped out. I want you to have like a good understanding of what everything means. Next slide, please. Okay, so the definition of trauma as brought in to include any experience that threatens one's physical and psychological well-being, including the ability to cope. So I'm not going to go through each bullet point here. However, just to highlight a few things, there's something called historical trauma, where it's trauma through the generations. There's other definitions of historical trauma connected to spiritual, psychological, and emotional distress. There's racialized trauma. So trauma can come in different forms, and the next slide will highlight that. Can you do the next slide, please? Yes. So I like to use this graphic because it highlights all the different types of trauma that can affect someone's well-being. So, for example, complex trauma. So that could be like abuse, violence. That could also be compounded trauma. That's not what I mean. Trauma. And so there's developmental trauma. So that could be neglect over the childhood, abuse, violence, witnessing. death. There can be historical trauma, like I mentioned with racism, acute trauma. So that is basically like a single incident you experienced that you knew you were different after. So they put here a car accident or a robbery. And then there's vicarious trauma. So that is someone who witnessed someone who experienced a traumatic event, a bystander, a witness. And I just want to make a point with this one, like also witnessing things happening on television to people you care about can also cause vicarious trauma. So a lot of times when things happen in the news and we watch it repeatedly, that can also contribute to experience this level of trauma. And then also repetitive trauma. So sometimes I like to say this is like death of 1,000 cuts, right? So as when you experience it once, it might not be that bad, but then when you're experiencing it repeatedly, it affects your functioning. So the next slide is going to talk about effects of trauma. Next slide, please. So I wanted to highlight this a bit because sometimes when we experience trauma, we think we can go back to life as normal, but sometimes we're changed. So it could come out as excessive worry, poor health outcomes. Maybe you're not taking care of yourself as best as you used to. Maybe you're walking through the world numb to yourself and not really caring about what happens to you. Sometimes people have sleep issues, eating issues. Sometimes there's poor communication and relationship loss, job loss, even change in mood, intrusive thoughts. There is a lot of, and these are just a few, there's a lot of different effects that can happen because of trauma. And some people can experience trauma and bounce back too. So it's not like this is going to happen. But I think the sooner we get help, the more you can mitigate those kind of issues. Next slide, please. All right, so I wanted to do some myths and facts with you guys. So you could just yell it out if you think you know the answer. Next slide. So 1 in 5 Americans are living with mental illness. What do you think it is? Myth or fact? All right, next slide. Yes, so on average, 43.8 million Americans experience mental illness a year. Next slide. Talking about suicide with someone who feels suicidal increases the likelihood that the individual will act on their suicidal thoughts. Yeah, correct. It's a myth. Talking about suicide with someone who feels suicidal actually decreases the likelihood of an attempt and increases the likelihood of someone reaching out for help. Next slide, please. All right. Compared with white, African Americans are more likely to receive guideline consistent care, more frequently included in research, and less likely to use emergency rooms or primary care. Myth. It's myth. So it's actually the opposite. According to the CDC, compared with whites, African Americans are less likely to receive guideline consistent care, less frequently included in research, and more likely to use emergency rooms or primary care. Next slide, please. Mental health and mental illness mean the same thing and can be used interchangeably. Correct. You guys know this. Everyone has mental health the same way everyone has physical health. Mental illness refers to a disorder you can be diagnosed with. So, for example, just like someone could be diagnosed with diabetes, they could be also diagnosed with bipolar disorder. I think we have one more. Next slide, please. There is no single cause of mental illness. What do you think? That correct. Mental illnesses can be caused by a variety of factors, such as biological predispositions, neurological trauma, effects from drugs and alcohol, and even other medical conditions. All right, next. So now we're going to talk about what do we do about it. So I'm going to discuss resources, how to get help, and how to maintain your mental health. And then at the end, we're going to do, if everyone can, and if you can't, that's okay. We're going to do a little breathing exercise, because I just want to walk you through just one kind of self-care thing you can do to help regulate your body. Next slide, please. All right, so what to do when you or a loved one needs help. So this could be very scary, especially if it's someone in crisis. So I want to highlight the one in the middle first. You do not need to be an expert. In nationally, we have a line called 988. And in New Jersey, they've made a lot of investment for 988 through the Department of Mental Health and Substance Abuse. So they have teams that will go out if 988 is called. So this is also a warm and a hot line. So meaning a warm line is you can call them, you can get support. It doesn't mean the ambulance is going to show up at your house. It doesn't mean that you're in any kind of trouble. It just means you're calling them because maybe you're having a very rough day and you're having some thoughts that are scary to you, or maybe a loved one has some thoughts that are scary, and maybe you just call 988 to see what to do. 988 is that warm line. They're also a hotline in that if there is an active crisis going on with someone's mental health, you can call them as well, and they will link you to 911. They will do everything that needs to be done and dispatch you so that the correct medical services can come. So I think this is awesome. This is pretty new. I think the last maybe 2 to 3 years that this has been implemented. So I encourage everyone to remember 988. You do not have to be a mental health expert. So if someone is not in a crisis and they just need some support, I encourage everyone, try to stay open, try to listen actively, without judgment. Support them, help them find a mental health provider. I think that after I talk about some resources, maybe you'll have some place to look when something happens, whether it's you or a family member or someone you love. Assess the situation, see if someone is saying they're going to harm themselves or anything like that. That's when you call 988 and use their warm line. It's okay to use their warm line. I encourage everyone to, because sometimes we just don't know what to do, and that's okay. I think that's why this exists. And also want to mention that I'm a mental health first aid instructor. So that is a course similar to CPR that can teach you a lot of things of what to do as a layperson to help someone who helps someone in a issue of mental health crisis and help them get some help, and for yourself. So if anyone ever wanted information about that, my information will be at the end of this. If you want more in-depth teaching and education on what to do in mental health first aid. Next slide, please. So I also wanted to just educate you quickly on the different levels of care that are available in New Jersey. So for someone who's having active suicidal thoughts, psychosis, self-harm, things like that, hospitalization might be the best thing. So that's pretty much hospital stay, It could be anywhere from 3 days to 21 days. It just depends on what the issue is. Then there's something called partial hospitalization. So that's more of like a program you go to every day for a period of time. It could be anywhere from 3 to 6 months, where you go to groups, you get medication, you get individual therapy, and you kind of step down. And then there's something called intensive outpatient. So compared to partial hospitalization, it's 3 days a week rather than 5 days a week. And then there's outpatient. So that's the therapy that's one-on-one. You can do family therapy. You could do couples therapy. There's groups. So that's what outpatient it means. Next slide, please. And then for medication assisted treatment, so those are for individuals who struggle with substance use. So some people take the route of getting medication assisted to be able to come off of opioids. There's case management. So case management is really for individuals who have a severe and persistent mental illness, who need individuals to help them to function in life. So for example, they might help them with housing. They might help them making sure they are on their medications, make sure they have resources, make sure they could live independently. And then there's long-term. So there's individuals who might need a hospital stay that is indefinite and permanent, or at least for a period of years. So that's, we have a few long-term facilities in New Jersey. And then there's respite programs. So respite is alternative to hospitalization. Sometimes individuals are having symptoms, but they don't want to go to a hospital. So in Essex County, CSP&J does this program, and it could max up to 14 days. All right, next slide, please. So I just wanted to highlight like the levels of care, because I think knowing what's available, even if you don't use, like you may never have to use hospitalization, but maybe you might need case management or outpatient, like it's good to know like what the different levels are. So I like this quote because I'm going to talk about therapy, which is a lot of what my experience is. So psychotherapy is a profession whose mainspring is love. Nearly everyone who visits a therapist has a love disorder, and each has a story to tell of love lost or love denied, love twisted or betrayed, love perverted or shackled to violence. So I love this quote because I feel like one of the big reasons I became a therapist is because I wanted to show other people what love was through a clinical lens, which is called like unconditional positive regard, letting them know that that's possible in relationships and so that they can implement that in their lives. Next slide, please. So there are different types of mental health professionals. There's psychiatrists. You can also get some medication from your primary care provider if you can't find a psychiatrist. There's also called a psychiatric nurse practitioner. And then there's all different kind of therapists on here. So pretty much social workers, family therapists, art therapists, drug and alcohol. There's so many different kind of therapists. It really depends. So if you start looking for assistance, you think about like what you're looking for, because there are all kind of things available that can help you. There's also non-clinical people. So sometimes that is what you need rather than someone licensed. So you might want to go to a life coach. You might want to go to a peer specialist, someone with lived experience to talk to. So it's not a one size fits all. I think I encourage everyone to think about the kind of help they would want and try to see if that's available. Start to explore, look online, look in your community to see what's available, because once I think these like hit words, then when you search them online, you'll be able to find them a little bit easier because you're understanding like with all the different terminology. Next slide, please. So Essex County resources. So the screening sites for Essex County specifically is Newark Beth Israel, University Hospital, and Claremont Hospital. So if someone were to be having a crisis, then it would be those hospitals. They would get screened, and they can either stay there or they can get diverted to any short-term psychiatric facility within the state of New Jersey. So for case management, so that is someone who has persistent mental illness, who needs like that one-on-one care, someone to come into the home and walk them through things. So the organization I work for, Mental Health Association, doesn't. Mount Carmel Gill does it. KRL, Rutgers has a program called EISS, which is like emergency psychiatric, but not hospitalization. So they'll do medications with someone who might need medications immediately, but they don't need to be hospitalized. So that's a walk-in facility. There's also something called Project Live and CSP&J for individuals who struggle with homelessness. There's in my organization, it's called PATH, where we help individuals gain permanent housing as well, because as we mentioned before, like people who are struggling with permanent housing, that is affecting them as far as their mental health as well. So that's something that is available. And then outpatient and partial care and intensive outpatient. The ones I mentioned here are the community health organizations. So meaning that they take state insurance. So Rutgers, Family Connections, Irvington Counseling Center, Northwest Essex, and Mental Health Association all cover individuals who have state insurance. However, if you wanted to find something for yourself, you don't have to be limited to that. That's just, I wanted everyone to have access to that information. Next slide, please. And then if you want to look for resources for yourself and you have insurance, there's a few other things you can do. There's this website called Psychology Today, where you can put your zip code and what you're looking for and find a therapist. You can call your insurance provider and they'll tell you who's in network. I meant to say BetterHelp. So there's these few websites called BetterHelp and Headspace, where they offer therapy online and you pay a fee each time. There's another website I really like. It's called Therapy for Black Girls. So pretty much it's a website that's awesome that you can go onto and put your zip code in and your insurance and find a Black therapist. Majority of the therapists on this website are women. And so I think it's just sometimes you want someone where you don't have to explain anything to, you just want to get into it. So Therapy for Black Girls is really good. And then they also have a podcast on mental health if there's different topics. So like, for example, they had a really good podcast on eating disorders with Black women. And so different information that you can learn from. So I wanted to include some different books and mindfulness apps that are available just to get you exploring. This is really just to spark your interest, explore, see what's out there, see what you might want and what you have access to. Next slide, please. This is also additional information, like different podcasts that I really like, social media that I really like. So if you want to take a listen to any of these things, I think you can find something that you connect to. Like for me, I really like Black Girls Heal. She talks about a lot of trauma, relationship trauma. She calls some relationship issues love addiction, and I think that can really connect to a lot of people. So you can explore and find what you really enjoy and what really encourages you to keep going with maintaining your mental health. All right, so next slide, please. All right, so maintaining your mental health. So a few things I want to highlight other than getting help and going to therapy. I wanted to highlight these two things. However, there's so much more out there. So one thing is self-care. So self-care is anything you can do for yourself. It can be a few minutes. It can be anything that brings you joy, anything that brings you contentment, anything that brings you any kind of relief. I encourage you to, so it could be a daily thing. So for example, that could be meditation. And one thing I want to clarify with meditation, sometimes we think meditation is clearing the mind. And in my opinion, I don't think some Eastern religions think about it like that. But for me, meditation is not about clearing the mind. It is really about getting still. Because sometimes when you meditate, you might have all these thoughts in your head and we feel like we have to force them out. But I think when you're getting still, it's okay. Let those thoughts race through your head. But you're having the practice of regulating your body. And so clearing the mind is one thing, but regulating your body through breathing is another. So you end up more so, rather than focusing on having no thoughts, you end up focusing on your breathing, on what you're hearing around you, not placing too much on what you're thinking and kind of being in the moment. So that's really what I encourage with meditation. There's prayer, there's taking walks, exercising, watching a movie that you like. There's so many things that you can do just for you. And I just encourage you, even with a busy life, 5 minutes a day can make a difference. Then setting good boundaries and building self-awareness. So that could be through journaling, through slowing down, through noticing yourself, understanding what your warning signs are. Like, for example, for myself, when I know I'm struggling, like I might be a little short with people, I might not listen as well as I normally do. When I'm struggling, I might not be getting good sleep. So when you start to notice these things about you that something's off, I encourage you, before it gets to the point of when you're in a place where you are in crisis, there are some things you can do on your own that can help you. And maybe sometimes for some people it might be journaling, to be like, okay, this is going on and that's going on. I'm really stressed about this. I'm dealing with financial stress. I'm dealing with relationship stress. Maybe I should talk to someone. Or, sometimes we go through a lot of stress and we're okay. But sometimes we're going through it and our body is talking to us. And I think one thing is just learning how to listen to our bodies. So I encourage you, don't go at this alone. Build a community. You have a community of people here, I encourage you, build community. Even if it's just a conversation of, how are you really? How are you doing? I'm going to wait for the answer. Because sometimes we say, how are you? We don't really wait for the answer, but wait for the answer, and a real authentic answer, a vulnerable answer. I just encourage you not to do this alone, and build relationships with people. I'm sure there has to be someone somewhere who feels that mental health is important, that you can connect with, that can be someone that you talk about, be vulnerable with. And I just encourage you to find that person, because this is not meant for you to do alone. Next slide, please. All right, so I just want to highlight some self-care things that we can think about. This one is called the circle of control. So when you think about, sometimes when you feel overwhelmed and you feel like, you don't have any control of a situation, sometimes self-care can mean literally sitting down and thinking, okay, what is in my control with this situation and what is not? And really, when things come down to your control, is It really has to do what can I do and what can I say. Everything out of that is out of your control. So I encourage, sometimes this exercise can help with just putting things in perspective and helping you to let go of the things that are harming you and possibly stressing you out. So some of the things they say, what's out of your control, the happiness of other people, what's out of your control. For today, for example, the weather, right? What's out of our control? Traffic, right? What's out of our control? Death and illness. What's out of our control? The past. We can't do anything about what happened in the past. But what about what's in our control? What I say and what I do. How I choose to react. How I spend my time. So sometimes thinking in those perspectives can help a lot. Next slide, please. All right, so here's another tip, reframing your thoughts. So there's different kind of reframes. You can reframe through empathy, through facts, through language, through context, and through behaviors. So this is another tip where you can work on your thinking. Because a lot of times our experiences culminate into like our emotions, our thoughts, and our behaviors. So if we try to make changes in any one of those areas, we affect the others. So these are just some tips that can be your own self-care of things you can practice to help you maintain your mental health. So lastly, I wanted to try one together. It's a breathing exercise. You can go to the next slide. Can you click on the little microphone thing? It has some sound. If it doesn't work, it's okay. It's right on this slide. You click on it. Do you see it? Yep. Yeah, press play. Oh, it doesn't work. Let's see. It's okay if it doesn't work. So let's try the exercise without the music. It was just some calming music with it. So I would like everyone to just take a moment, unclench your jaw. Sometimes we're clenching it, we don't know. So unclench your jaw, relax your shoulders, pull them back. Put your feet on the ground, look straight ahead. And I would like everyone, if you don't mind, to close your eyes and focus on your breathing. Place one hand on your stomach and your chest. Breathe through your nose and out through your mouth. If you can't, you could just breathe through your mouth. And I'd like this to do this 3 times together. Let's take a big deep breath. Breathe out. Let's take another deep breath. And in our last breath, I would like you to pay attention to the sound of your breathing. Let's take a deep breath. All right, you can open your eyes. So that is you can stop the sound, even though it's nice. That is something you can do yourself, and it just takes a minute to regulate your body, to get in tune, to get present. And if you notice, if you notice that, okay, my jaw was tight, my shoulders were like this, I feel a little calmer. Maybe you can do more breaths, or find something else. Like maybe breathing is not for you, but maybe it's like making sure you get outside and take a walk even when it's cold, or maybe it's something else that helps you to be in tune with you. So I just encourage you, we can go to the last slide. I encourage everyone to figure out what works for them. to educate yourself on what resources are available to you. In Essex County, there are a lot of grant-funded programs. So I just encourage everyone to figure out, like, what is it that I need to put in my toolbox? What is it that I need to know so that I know what to do and I know how to get help? And what can I do on a regular basis to maintain my mental health and embrace it and make it part of my total well-being, my physical health? Because I think we have one body, and the way we take care of it, the way we take care of ourselves mentally, emotionally, physically, spiritually, all these things, I think we can all make it one thing. Does that make sense? All right, so thank you so much. This QR code, if you take out your phone, is my LinkedIn if you want it. And then, or you can take down my email if you have any questions. And that's it. Thank you so much.
Wow. So informative, yes? Yeah, and I love the way that Rachel put it, that we all need a toolbox, first of all, and to make sure that it's filled with the right things, because life happens and trauma happens, and sometimes we're even carrying trauma that we didn't realize. So thank you, Rachel. Let's give it up for Rachel Haley. Thank you. Today, we're going to look at the topic of breast cancer through the powerful lens of two women who are making a difference. Our first speaker is a full-time breast surgeon who focuses exclusively on the care of women with malignant and benign breast disease with a comprehensive, patient-centered approach, and she's passionately changing lives and the way women view breast health. She will be followed by a sister who, through her very triumphant experience, is encouraging women to boldly take charge of their health by sharing her personal story. Our first speaker will be Dr. Rebecca C. Yang, surgical oncologist, Jersey City Medical Center, and she will be followed by our own Sharon Hinton, residency coordinator in the OBGYN department for RWJ Barnabas Health, Newark Beth Israel Medical Center. At this time, please welcome Dr. Rebecca C. Yang.
Thank you so much. It's such an honor and a pleasure to be here, and I am, that first presentation was amazing. It gave me a lot of insight and reminded me that, yes, we all need to take 5 minutes for ourselves, or a minute for ourselves every day. Slides, please. So I'm going to talk to you about a little education about breast cancer, and most specifically about breast health and what we can be doing to be proactive about our own breast health. So I'm going to start talking, and hopefully we'll have the slides up. So breast cancer has been around a long time. I mean, the first description of breast cancer was an Egyptian papyrus describing a person who had a locally advanced breast cancer. And, back then, obviously, we didn't have any screening. Do you guys see my PowerPoint? I can send it to you again if you have an email. So breast cancer is the most common diagnosis of cancer in women in the world. Every year in the United States, approximately 250,000 women are going to be diagnosed with breast cancer, and about 40,000 women will die of breast cancer. Actually, New Jersey has the highest incidence of breast cancer in the United States. I think there's lots of reasons that breast cancer happens, and I will be going over this. I just want to pull up my slides myself to remind myself of what's hopefully. So there are many. So if you look at the statistics for breast cancer, it's very common still. However, it is not the most common cause of cancer death. Lung cancer is still the most common cause of cancer death. Breast cancer still, however, is the second leading cause of cancer death in women. When we look at the statistics, the incidence has kind of stayed the same, but part of it is probably because we are actually better at identifying breast cancer, screening for it. But thankfully, the risk of dying from breast cancer continues to decrease because we have continued to advance our ability to cure breast cancer, as well as the biggest one of the biggest advances is screening and early detection. If you catch breast cancer early, you almost always catch it at the first stage, which is curable. So we do know that breast cancer incidence depends on race. Any update on the slides by chance up there? Huh? Okay. Because I can't remember everything. I'm like, I thought I knew everything, but
Sing a song.
I could do a dance. So we do know that there's different. The incidence of breast cancer is different in race. So Caucasians have the number one incidence of breast cancer. African American women have the second common incidence of breast cancer. Hispanics, Asians, less. However, there's a difference in the age at which women get breast cancer. Caucasian women tend to get breast cancer a little bit later in life, and so we divide age of diagnosis between what we call premenopausal, which is basically before age 50 and after age 50. And there's definitely been more information identifying the fact that African American women, although they get breast cancer less, tend to have it diagnosed at an earlier age. And that's very important in educating our communities about the importance of screening. Unfortunately, because as even Rachel indicated in her first slides, is that most of the research, most of the resources in general up until recently really went to Caucasians in general. Most of the data we know, because not the inclusion of women of all different races and was not as prevalent as now. So we do know that the African American women have a more of a common, different type of biology of cancer sometimes, and also as a result they've not benefited from the advances in research, and still outcomes are not as good. And part of it is trying to increase education to get women to get screened earlier. Unfortunately, social economic disparities that have still impact the African American community. So there are many risk factors for breast cancer. And the risk factors we divide into what you can control and what you can't control. Just like that circle that she showed you about what can you do to control your mental health, certain things you have no control over. Hey guys, it's a minute, what's going on? So, what you can so the things that we cannot control are most of the things that we bring to the table. They include the number one risk for breast cancer is being a female. The second risk is age. People think that when I get older, I don't need to get mammograms, I'm not going to get breast cancer. Actually, the number one risk for breast cancer besides being a woman is getting older. Because the main theme and risk for breast cancer is estrogen exposure over your lifetime. Estrogen is the female hormone that makes us women. So the more life you live, the more estrogen your breast cells are going to see. And estrogen is the thing, the hormone that stimulates breast cells to change. And over time, if there's enough estrogen to cause a breast cell to change, sometimes it'll change into a cancer cell. And that cancer cell then multiplies and multiplies and becomes a breast cancer. So that is the overarching theme and why the risks that you cannot control. So the older you get, the more likely you could get breast cancer. So estrogen exposure is also based on when you've had your first period. So if you have your period before 11, that's a slight risk because already your breast cells are getting a lot more estrogen. Late menopause. When do you go through menopause? Usually the average age is between, okay, great. So can you, okay, keep going. So you can see, stop. Okay. So as here, age. So the lifetime risk for breast cancer in general is 12%, 1 in 8. Next slide. But again, it's as you get older, the risk goes up. And these are just statistics showing that the trends in death rates continue to go down for breast cancer. Next slide. Next slide, please. Next slide. Okay. Next. Thank you. Okay. So I'm going to first talk about the things that we can control, which are still all based in kind of estrogen exposure. So being overweight, that is a risk for breast cancer. And the reason is that all those extra fat cells are where extra estrogen is made. You make estrogen in your ovaries, but then you add that extra estrogen in your body, that increases estrogen exposure to the breast tissue. So it's a worldwide problem. In the United States, it's a 50% problem. So it's something that we can control. And, it's easier, it's a tough thing, though, because it's easier to say, you lose weight. But we know that more advances show that there are other genetic issues. But thankfully, there's these new drugs now, the Wegovy, the Ozempic. But obesity is a real risk factor for breast cancer. And it not only increases the risk for breast cancer, but it affects healing after surgery. It affects the drugs that we have to give patients because a lot of the drugs have to be given based on weight. So, and going along with that is lack of activity or exercise. So exercise alone has been shown to reduce estrogen levels in the circulation. And it also helps with losing weight. And as our Rachel said, mental health too. Smoking continues, it's a cancer stick. When I see my patients, there's nothing to say except please stop smoking or you need to stop smoking. People thought it only is just related to lung cancer, but it has been shown there's a direct correlation to breast cancer as well because all the toxins that you inhale include things that act like estrogen that affect the breast tissue. Alcohol, we hear just the other day, the Surgeon General just said alcohol is just bad. There should be warning labels. The more we find out about, the more we know it has detrimental effects on all aspects of our health, but specifically breast health as well, because it also acts like estrogen on the breast tissue. And unfortunately, things that we did when we were younger affects what happens in the later life. So in general, when I see my patients, meet with them, I ask all these different questions about their lifestyle, and certainly we definitely want women to drink less than 4 glasses a week in general. And again, certainly if you're going through treatment, you want to be stopping alcohol. History of breastfeeding is actually something that, whether or not probably not an issue for a lot of people now, but if you did, or if you're going to get pregnant and have children, breastfeeding is good. It's a protective factor. It is good for you and the baby, obviously. It gives the breast tissue a break from estrogen exposure. Hormone replacement therapy is, when you go through menopause and you sometimes have really bad side effects like hot flashes, night sweats. They're just so bad that estrogen can help mitigate those symptoms to get you through at least the initial hump of that. Has been shown to slightly increase a woman's risk for breast cancer because, again, you're taking it after you went through menopause as, the normal evolution you're supposed to. And if you extend that estrogen exposure, again, you're extending more estrogen concentration to the breast tissue. Next slide. So a little bit more about obesity. Next slide, please. Next, just click. So that means a BMI, body mass index greater than 25. Next slide. Again, it's more important actually after menopause because before menopause, it's still the estrogen produced by your ovaries has much more impact. And again, the reason why it's important is because more fat cells create more circulating estrogen, which stimulates breast cancer development. And the apple shape is more important because it's the obesity around your belly that seems to have more impact than the obesity around your hips. Obesity also increases the risk for breast cancer recurrence. Next slide. So exercise habits. What do we want people to do? Just be a little bit more active. Next. But ideally, we'd love for everyone to do 30 minutes of exercise 5 times a week, or as they say, 150 minutes per week. This has been shown to reduce the risk for breast cancer by 30%. Easier said than done. A lot of times we're all very busy, but again, if you, as Rachel said, focus 30 minutes a day on yourself, it's not a lot of time, but it's good for mental and physical health. Next slide. Smoking, just bad. Next. So if you smoke, you're at a 10%, you have a higher risk for breast cancer, 10%. It's associated with a higher risk for developing breast cancer in younger women. It can affect healing and increases the complications with treatment. And it also, if you're a smoker, it increases the risk for recurrence and reduces survival. Next. Next. So as I said, alcohol increases the risk for breast cancer. The more you drink, the more you increase your risk. 10 glasses per week increases the risk by 10%. As I said before, I try to counsel my patients, drink less than 4 per week. Next. Again, if you breastfeed for more than a year, it's protected, but in general, we say at least 4 months. What happens is you have fewer menstrual cycles when you're breastfeeding, there's less estrogen, and in general, you're just gonna have a healthier lifestyle because hopefully you're being healthy for your baby. Next. And again, hormone replacement therapy is when you're taking estrogen or progesterone to treat some menopausal symptoms. There's 2 types of hormone replacement therapy. One is called combined, which is estrogen and progesterone, and those are for women who have a uterus. If you had a hysterectomy, you only take estrogen, so the risks are slightly different. But again, you can't live a miserable life if your side effects are so impactful. But we definitely want our patients to work with their OBGYN or PCP when you're taking hormone replacement therapy to minimize how long you take it. So what are the things we cannot control? Next. Those are things that you bring to the table. Next. And as I just keep clicking, please. Again, like I said, you're a female, your age, race, so more women Caucasian women get breast cancer than any, but still all women are basically at risk for breast cancer. If you have breast cancer before, obviously your risk is higher than it was if you didn't have breast cancer, a history of breast cancer. If you've ever had a biopsy and your doctor told you that they found something called a high-risk lesion, those are not cancer, but if we found that on a lumpectomy or a biopsy, it puts you at a higher overall risk for developing breast cancer in the future. And the names are atypical ductal hyperplasia or atypical lobular hyperplasia. If there's a strong family history and there's a gene that runs in the family, most people have heard of Angelina Jolie. I call it the Angelina Jolie gene. But about 10% of women who have breast cancer because there's a gene that runs in the family that was passed to them that was the reason they got breast cancer. If you've had a history, young women used to get radiation treatment when they had lymphoma. And if you've had a history of radiation treatment for cancer when you were younger, that increases your risk for breast cancer. And then there's something called mammographic density. If you've had a mammogram and they tell you, oh, you have dense breast tissue is an independent risk factor for breast cancer. And I'll show you what those look like. Next, please. Now, we can't forget, men also get breast cancer. Very rare. It's 1% of all breast cancer diagnoses. So obviously, it's so rare. Men don't get mammograms, but we do want our men to, like, if they notice a lump, not ignore it. Richard Roundtree, Shaft, he had breast cancer. Beyonce's father had breast cancer. It's a little bit more common in African American men. Next. So again, getting older, but the rate it continues to increase over time. So we hear about, we hear lots of stuff in the media more about the young women who get breast cancer because that's just more, media, like people seem like, oh, that's more shocking, I guess. But actually, most women who get breast cancer are over 50, and the average age is about 62. So again, you don't stop getting mammograms when you're 70 if you're healthy. You still could get it. In fact, I've taken care of women who are in their 90s and almost to 100, and they still get operations. Next. So again, it's more common to happen in Caucasian women, but African American women, second most common. Next. And again, unfortunately, breast cancer death is a little bit higher in African American women, stage for stage. If you have a personal history of breast cancer, you're more likely to have another breast cancer. So that's why breast cancer survivors are obviously followed very closely, continue. If you've had a history of something called atypical hyperplasia on a biopsy, or something else called LCIS, your risk is higher. And again, if you've had that, we hope all our patients have been educated that they have it and that they should be followed more closely. We follow women, we have a high-risk clinic, actually, where all the breast centers that are part of RWJ have high-risk clinics. There's one at Clara Mosque where we follow women who would have that. So if you have a family history and it looks like there are multiple women that have had breast cancer or ovarian cancer, or it seems like you talk to your family, you're like, oh, grandma had breast cancer, mom had breast cancer, there's a higher chance that maybe there's a gene that runs in the family, and we can test for those genes now. When I first started training 25 years ago, we only knew about 2 genes, but now we actually test women for 84 genes. It's either take a sample of, go back, please. It's either like we can take a sample of saliva or your blood and we test it for genes. Because it's important. If you have one of these genes for breast cancer, it may affect how we manage you. You can be proactive if you don't have breast cancer and we start you on a much more intense screening. You can consider preventative surgery. But it's also not that common. So we reassure patients that ultimately, no, this is not a gene, it's not something you could pass to your children, but it's good to know about it so you can be educated. And so these are the different reasons why we would test someone based on their family history. And if you test negative for the gene, though, even if you don't have the gene, having a family member with breast cancer still is a higher risk for developing breast cancer, because maybe it's something in the environment that you all grew up in that made you more susceptible. Next, please. Next, thank you. So again, if you've had a history of if you've had a history of radiation to your chest for treatment of another type of cancer, that does increase your risk for developing breast cancer, because radiation can cause cells to change to become cancer as well. So women who have had that history are sent into a high-risk program as well. Next. So mammographic density. It looks like most women here probably have had a mammogram. And I don't know if you ever were told what your density was, but it's nowadays we are required, all breast imagers are required to inform the woman what her breast density is, because 50% of women have what we call dense breast tissue, which is an independent risk factor for breast cancer, which means that when they get screened, you may want to add an ultrasound, or we want to make sure that you're having what we call three-dimensional mammograms. Next slide. So there's 4 categories. A is fat, basically all fatty breast tissue. And on a mammogram, fat looks black and breast tissue is white. So this woman has fatty breast tissue. This is not dense. It's very easy for us to read. So these women just need a mammogram every year. It means detecting something small is much easier. Next, please. This is what we call scattered fibroglandular density. This is not dense either, because there's more black fatty tissue than breast tissue. So again, these mammograms are considered very straightforward. You don't need extra supplemental ultrasound. We can feel very comfortable that you're going to get a good reading and that we should be able to detect a change. Next. So this is called heterogeneously dense breast tissue. C and D are what we call dense breast tissue. And you can see that there's a big patch of white, which is the breast tissue. If your breast is more than 50% breast tissue than fat, then that's dense breast tissue. And in those areas, it may be a little harder to find something very small that's developing. Next. And this is extremely dense breast tissue, which is really a very, we call it the radiologist's nightmare, because it's just a whiteout. It's like looking for a polar bear in a snowstorm or a plane on a cloudy day. And so to find something very subtle may be challenging. Next. So there's a breast density law, next, that was enacted in 2019 because of women who had routine mammograms, had very dense breast tissue, but ended up having a very large breast cancer because it was hidden in the breast density. And so she was diagnosed at a more advanced stage and needed chemotherapy. Thankfully, she survived, but she became very proactive in saying, hey, we need to educate women about their breast density. So nowadays, when you get your mammogram, you'll get a report, and it also tells you your breast density. Next. The good news, however, is, so despite that, breast cancer is treatable. When women come to us with a diagnosis, we want to reassure them that it is treatable, and we can, and the goal, though, is making sure that women get screening. Screening is a way to detect it before you feel it. And thankfully, early detection and improved treatment, next, have continued to improve outcomes. So screening really is the key. Next, please. So screening involves not only getting a mammogram, but just being aware of your breast health and also seeing your primary care or your GYN for a breast exam once a year. That's called a clinical breast examination. Breast self-examination is kind of not what we use anymore. We say breast health awareness. And then again, when you turn 40, and every year after that, you should be getting mammograms. Next, please. So breast health awareness doesn't mean that you should do a self-examination every month. It means that you live in your body. You know your body best. You take a shower. You wash yourself. You put lotion on. We want you to be aware of what your breast tissue feels like to you, and if there's anything that's different, that feels different to you, pain, lump, anything that you're not sure about, that you do not ignore and seek, see your PCP or OBGYN. people used to think that a self-examination improved breast cancer survival and detection, but there was a big trial where they took thousands of women and they randomized them to self-exam versus nothing. And the only thing that happened was that they had much more unnecessary biopsies, more anxiety without any improvement in breast cancer death. So we don't say, and when I ask women, I'm asking more out of curiosity to reassure them that they don't have to do a self-exam and just be breast health aware. Next. Next, please. So these are all the different things that you need, that you may find when you're taking a shower, looking in the mirror, that you want to be aware of. Obviously, a lump that feels different to you, any change in the appearance of the nipple, any skin changes, redness. If you start having discharge without doing anything, that's called spontaneous discharge, without any compression. You just look down, all of a sudden you're like, whoa, there's some discharge. And obviously anything that looks bloody would be anything that would immediately send you hopefully to the doctor, because that wouldn't be normal. Most of the time, or any sudden change in one side of the breast compared to the other. Now, most of the times, next please, these are not going to be, ultimately, probably not related to breast cancer. Next please, but something that you certainly want your doctor to evaluate. Next please. So the key to reducing breast cancer death and improving survival is screening mammography. Because a breast exam by even your doctor is really like a coin toss in terms of finding something small. So ever since routine screening mammograms were started, there's been a 30% reduction in breast cancer death, and it really is the only screening tool that has proven to work. It is the baseline. People say, why can't I get a breast MRI? Well, a breast MRI is a good supplement, but you need the mammogram first. Next, please. So nowadays, thankfully, there's been the advance in mammographic technology, and it's called 3D tomosynthesis mammograms. Next. And what these do, it's almost like doing a CAT scan through the breast tissue. So it takes 1 millimeter slices through the entire breast. So if you look on the right side, no, the left picture is what a routine mammogram looks like before we had the 3D technology. And then if you look at the right side with the circle, obviously, there's a cancer there that the 3-dimensional mammogram caught that the 2-dimensional mammogram did not catch. And so thankfully, I believe in New Jersey, every imaging center has 3-dimensional mammograms. But certainly it's good when you're getting your mammogram to confirm that they do. Because the 3-dimensional mammogram technology helps deal with the dense breast tissue. It helps us mitigate the presence of dense breast tissue. Next, please. So again, like I said, mammogram is the only tried and true screening modality. However, a lot of times if you have dense breast tissue nowadays, you will get a note saying we should supplement that. Even though we have good 3-dimensional technology, we usually do add an ultrasound at the same time. But these are not screening. They're addition to the screening of a mammogram, because mammogram ultimately can pick up something called calcifications, which are little tiny calcium specks that will not be seen on an ultrasound or an MRI, and that can be the very first sign of early breast cancer. Next, please. So the supplemental imaging studies are breast ultrasound. Next. And it's, just like an ultrasound. You put it on the breast tissue, and it looks for things that can see through the dense breast tissue. It has been shown to increase detection, but a lot of times the problem is it's not as specific, so you find a lot of things that are benign, incidental, so sometimes it leads you to unnecessary biopsies, but it's certainly a good adjunct. And I do think that the rate, in New Jersey especially, they've been more advanced in always adding ultrasound, so I think they're very good at it. So I think the callback rates for unnecessary biopsies are much better. Next, please. And the other thing is MRI. So MRI uses magnets to look at the breast tissue, and anyone, if you've ever had a breast MRI, you get an IV that gives you a dye called gadolinium. It circulates in the breast tissue, and it looks for abnormal blood flow. And if you see on the left side of that screen, there's that little red, blue spot. That's where the breast cancer is. And they only see that because there's more blood flow. That big red spot is the woman's heart. So you know that's what blood flow looks like on an MRI. So MRI, again, is a great adjunct to screening, but it's not screening alone. Next, please. So what are the screening guidelines? There's 2 basic risks for women for screening. One is for women with an average lifetime risk, which is most women. So the lifetime risk for breast cancer, assuming you live to 90, is 1 in 8, 12%. Then there are women who, based on certain things that we talked about in the list of risk factors, if you look at all their history, their medical history, their age, if you calculate that their lifetime risk is more than 20%, there are different recommendations. Next, please. Next. So, in general, if you can, we recommend that when you're about 25, you have a risk assessment with your PCP, which looks at your medical history, your family history, your age, your GYN status, and that kind of helps guide what you're going to do in the future. Women with average risk should start mammograms at age 40, not 41, not 42, 40. And actually, there was a paper that came out saying that it's very important, again, to hopefully educate the African American population that really young women, and 40 is young in my opinion, should start getting mammograms at 40, because sometimes that's breast cancer is diagnosed earlier. And it should be done every year. Every year, and you don't stop at age 70. Most women are very healthy at 70. You start discussing when do you stop screening mammogram. It's generally if your life expectancy is less than 10 years based on your other medical issues. Next, please. So between age 20 and 25, again, we do another risk assessment. And then we also look at family history if there's an indication for genetic testing. Next. And then again, after 30, we do another risk assessment. And at that time, we calculate a woman's lifetime risk for breast cancer based on a model that we plug in all the information we've talked about, and that calculates her lifetime risk. And if it's more than 20%, next please. Oh, that's the computer analysis that I have on my desktop. When I meet women, I put in all this information. Next. And so we calculate their lifetime risk. So again, if your lifetime risk is average, this is the guidelines we recommend for women before age 40 and then 40 and older. Again, everyone should be aware of their breast health. They should get a breast examination with their PCP or GYN every 3 years if you're under 40, but after 40 and over, every year annual with your PCP, have a breast exam. You should have a mammogram and just be breast health aware. Next, please. If your risk is more than 20%, we may add breast MRI to your breast screening as well. And for certain women that have a gene for breast cancer, like if we know they've tested positive for one of those genes, we actually start screening MRI first at age 25 and then add mammogram to when they turn 30. And again, you always want to maintain your breast health awareness. You want to be proactive, seeing your doctor. And when women are at higher risk, we want them to get a breast imaging study every 6 months. So what happens is you get a mammogram once a year and an MRI once a year, and you stagger them so you have something every 6 months, because the goal is to catch something early. Next, please. So ultimately, what are the things we want to do to improve breast health awareness, and how can you be proactive? Well, they're all the things that your doctor wants you to do, kind of, and also good for mental health too. So maintain a healthy weight, eat a balanced diet, try to get a little bit more exercise, limit your alcohol, quit smoking if you are, be proactive for yourself, have your regular screenings as based on your age, know your family history. I know a lot of us, especially the older generation, didn't talk a lot about family history. I think it's more, and so it's difficult conversations sometimes. And a lot of times, a lot of women come to me and they say, oh, if they have a diagnosis of breast cancer, they say, oh yeah, now I find out that my grandmother had breast cancer. So it's, try to open the conversation, because it's to help the whole family. The more you know about your family history, the better for you. When you go through menopause, try to work with your doctor about if your symptoms are, you just need something for temporary management of your symptoms. Work with your doctor to minimize how much you take it. And then again, there's a lot of things that we still don't know. I mean, I think there are a lot of environmental things that all those plastics, all the extra antibiotics people take that get in the water, get in the environment, New York, New Jersey, there's chemicals everywhere that are in our environment that I'm sure we do know that some of them act like hormones. So, and actually breast cancer is more of a first world problem than a third world problem, because of all the chemicals, all the environmental things that make our lives better in a certain way. We live longer, but ultimately may be detrimental. So those are the things that really are out of our control, but trying to do things like, avoid microwaving things in your plastic containers, use glass, use, your reusable bottles. It's tough. There's only so much we can do, but that's another thing that I'm sure has an effect. Next, please. So again, the key is being proactive. Take time for yourself. All the things that your doctor wants you to do are kind of what we want to do for your breast health. And the most important thing is screening. Get that mammogram at 40 every year, every 12 months, not every 13 months, not every 15 months, every 12 months. Early detection is the key. Next. Thank you. Any questions? We have about 5 minutes, so I don't know if you have any questions, but, or I do have 5 minutes. I don't know if we need to go, but thank you very much.
Let's thank Dr. Rebecca Yang. Yes, that was so informative. And it just really empowers us. For so long, there was this great fear attached to breast cancer and breast health. And now, with doctors like Dr. Yang, we are being empowered to take charge of our health and our bodies ourselves, and to understand the role we play even in diagnosis and the care that's given to us. Thank you so much, Dr. Yang. And now we're going to hear from our own Sharon Hinton, going to tell her personal story. Sharon Hinton, as you know, is a residency coordinator, the OBGYN department at RWJ Barnabas Health, Beth Israel Medical Center. Sister Hinton, won't you please come forward? And while she's making her way, I want to thank those who are watching online. I even received something through social media from a sister in Texas, and we know that you're out there watching, and we thank you for joining us today. And just to know that nationwide, this healthcare workshop is really shifting the dynamics on health by empowering us with information we need to know. Thank you.
Good morning, sisters. And thank you, Mickey, for letting me speak about this. This is very personal to me. I'm just going to be talking to you about my experience. I was diagnosed with breast cancer in my left breast in February of 2023. So next month will be 2 years. I did my annual mammogram, which I do every year. And of course, I get a call saying we found something. So as soon as they told me that, of course, I got scared. I didn't know what to expect. I was nervous. I started crying. It was just very, very emotional. So then when they said it was definitely cancer, more scared, more tears. I was all over the place. So then once I got through that part of it, the emotional part of it, I said, okay. I sat down with my breast surgeon, my PCP, and my OBGYN. All three of them were involved in this. So then I started thinking, okay, wait a minute. I have to tell my daughter. She is the only child. How do I tell this to her? How is she going to take it? So myself and my 3 physicians, we were on a conference call to call my daughter. And I was so like scared and like, how's she gonna take this? Because she's it. I mean, she's my only child. I'm her parent, so how is she gonna take this? So we finally called her. We did a conference call because she's in Charlotte. You guys know I go to Charlotte every year. So she's in Charlotte. We called her and, told her, explained everything, because I needed the clinical people to be involved in this. So, because I was all emotional. Like right now, I'm getting a little emotional now. So we called her and they told her everything, and she was very, very quiet. So I got more nervous. So they asked if she had questions, and she did. One thing about my daughter, she asks questions. She's very vocal, respectfully. She's very vocal. She asks questions and things like that. They answered all her questions. So after that, I talked to her when I got home. I talked to her privately and said, "How do you feel?" So she told me how she felt. She said, "Yeah, I'm scared. I'm nervous." She said, "But as long as you're okay, I'm okay." I said, "Okay." So I knew I had to be a little bit stronger for her, so because when you hear the word cancer, nobody expects to hear the word cancer. When you hear cancer, oh, it's an eye opener. Okay, it is an eye opener because nobody expects to hear that word. But like the doctor said, breast cancer is one of the number one that's, I guess, where the survival rate is very high, especially if you get it really early. So then my doctors, we came up with a plan. I decided to do a lumpectomy. Just remove it out, and that's it. I didn't want to do anything else at the time. My mental state wasn't ready for all that other stuff, taking the breast, removing this, remove both breasts, do this and that. I didn't want to do all that. So what happened was we did a lumpectomy, and after that, I did 4 weeks of radiation. The good part is I did not need chemotherapy because they caught it in time. So I did not need chemotherapy, which was like, oh, great. So I did the BRCA test, which the doctors talk about. That's a test where they test all the genes in your body to see if you're susceptible to other cancers. And that was another awakening because, we all have families, like grandma, parents, this and that, but I really know, you don't know the history, the health. So then I had to go back and speak to my aunt who's 90 years old, and then I found out my grandmother had breast cancer, my aunt had breast cancer, but my mother didn't have breast cancer. So it's like, that was another eye-opening too. It's like, okay, wait a minute, I didn't even know all this. So then I found out all that. So I did the BRCA test, which tests all the genes and all that kind of stuff. So that came out really good. So I did the lumpectomy, I did the radiation, now I had to take this medication for 5 years, and sometimes medication have effect on your body. The medication, it does mess with your joints. It makes your joints ache. So now I got to take fish oil. So it's like one thing adds to something else. But one thing I could say, this disease tested my faith because I never said, "Oh, why you get breast cancer?" I just started praying, like, you know what? I'm gonna be okay. I'm gonna be okay. Because, I had a great support system. I had fantastic doctors, fantastic. I work at Northwest Israel, so that made it even easier because I've been there for 18 years, so I know a lot of doctors. I knew my breast surgeon, before I even had cancer, so. And I work at OBGYN, so I knew all the doctors, so that made it even better. So I had a great system with the physicians, and then I had a very, very small circle of friends that I kind of confided in. I didn't want to tell too many people because I didn't want to feel like, oh, you got breast cancer, because some people, it's just part of life. Some people get emotional. Oh, you got breast cancer. I didn't want to feel like that. So I only told a very, very small group of people. Like a lot of people in the church didn't even know until I said something about it, and I'm like, this may help somebody else when Mickey asked me to speak, because you never know what people are going through. So I kept it really tight-lipped. So after all of that, I made it through. I take medication. I go to my oncologist every 3 months. I get my mammos. I cannot say enough, lady. This doctor emphasized on screening. Please, please, please. I've been doing it before. This for years, like when I was 40. Now I'm in my 60s, but I cannot emphasize enough. Please get your mammos. That's how they found us, because it was very, very small. Get your mammos, because, like she said, even till you're 100, if you live to 100, whatever, get them. Please get them, because it was, I did not do breast examinations. I did not. I mean, I knew my body, but I didn't really, because my breasts, are very dense. I'm like, I don't know what I'm looking for. What am I feeling for? So those mammos are like the best. Like I said, I see my oncologist every month. I get my screenings. So anything to do with my health, I'm at the doctor's every year for preventive or just to, see what's going on with my body, OBGYN, things like that. So I just can't emphasize enough about this whole breast, because it just really was an eye-opener with my family, my daughter, and it's just because I never experienced anything like this in my life. So I'm keeping this short only because there's really nothing more to say except for screening. If you have daughters, screening. So now my daughter has to do this for herself, because now I had it, so she has to go and do these exams as well. So that's basically my story. And if you want to talk to me, by yourself, if you're going through something like this, absolutely, I'm available. I'm here. So thank you very much.
Let's hear it for our own Sister Sharon Hinton. Thank you, Sister Hinton, for sharing your story. That when you can really put a face on it and hear the experience, that makes it real. And not to certainly discount what we see and hear in our doctor's office for any reason, but when you know someone who has been through the journey, that makes all the difference, and it really informs you in a different way. It's certainly, with Sister Hinton, it speaks a lot to faith. It's interesting when we talk about things that we can control and what we can't control. The great thing is to know, too, that when we do our part, that there is a greater part that's being done on our behalf all the time, and that's through the hands of God. So, and that is, I'm sure, Sister Hinton, that's what kept your composure. At a certain point, you shifted to a whole other level after telling your daughter. Then you realized you had this great support team around you. You had God on your side, and you had everything going for you. And so that really makes all the difference in how we experience things. So thank you so much for sharing your story. So I'm looking at our schedule now, and we have a 15-minute break. So we're going to take a break now, and then we're going to come back in a combined general session, and Alan Watson, a sports performance and enhancement specialist, is going to speak to us about the connection between obesity and disease. And we know that there is a lot to say. There's been a lot of development in the last several years on the connection between obesity and disease. And he's going to talk to us about that. It's certainly more than, I just need to lose some weight. We're now looking at body mass index, where you saw in Dr. Yang's report, a body mass index, ideally you want to be at 25. Once you cross that, you're crossing over into the obesity category. And you may not look like it. The scale may say one thing, the doctor's saying you need to lose some weight, but now they know that body mass index plays a great role. We know that fat cells harbor disease. That's another reason why we have to look at it. We know that body shapes play a great role, whether you're an apple or a pear shape. We know that belly fat is the dangerous kind of fat. Not that any of it's healthy. Belly fat is the dangerous kind of fat. And we know a lot of that comes about from cortisol. We know that that not only puts us at risk for breast cancer, we know it puts us at risk for heart disease. So certainly our next expert after this break is going to talk to us about the relationship between obesity and disease and how we can take charge of our health and prevent the stats. We want to change the stats. I know for me, every time I hear African Americans are disproportionately affected by this disease or that disease, I want to change the stats. I want to see us not be disproportionately affected. And what they're saying is that, again, a lot of it's in our control. through what we eat, through how we live our lives. One of the basic things that general practitioners are asking now, if you get 150 minutes of exercise a week. You've got monitors on your watches that tell you how many steps you're taking. So we have a lot of things at our disposal to help us meet those goals and to help keep us on the side of preventive care as opposed to intervention, and certainly needing more than that. So we're going to take this 15-minute break, and then we're going to all come back in here, and we're going to have the conversation about obesity and disease. Thank you. And again, thank you to those who are watching online, and please share your feedback with us. Thank you.
Ladies, I'm going to call 3 raffle tickets. You didn't get one? Go get one from Vivian. A Bible. A Bible. The first one, the last 3 numbers are 160. The next one is 156. Okay, this is the last one until after lunch. The last 3 digits are 158. Nobody has 158? Okay, they probably downstairs. Let me check. Let me see if they're downstairs.
Elliot, you up there? Elliot? Where's Elliot? Elliot, if you can hear me, come up to the main auditorium. We're about to start the next session. I need the lapel mic. Elliot, can you give me the lapel mic? It's down here, right? Oh, duh.
I brought them all down.
Gotcha.
So you want me to give it to?
Yeah, give it to you. Where you get? Is he out there? Yes. So we're going to ask everyone to make it into the main auditorium And we'll make it to the main auditorium, please. And I ask everyone to make it into the main auditorium. For those who are here, before we start to live stream, and just say this on the program. And obviously, we've called multiple audibles throughout this morning as a result of weather, sort of delaying people in terms of coming and delaying the speakers. So we have to do a couple of audibles. But on the back of this program, there's a QR code that we're asking for you to. And I'm going to make this announcements again, Sister Teller and I, throughout the remaining of the afternoon. But there's a survey, a QR code for a survey. So we can just kind of take your phone, if you haven't done it, and act like you're taking a picture of it. And it's going to ask you to click on it, and the survey will pop up on your phone. And it's probably around 10 questions. You don't necessarily have to take the survey right now. I'm just kind of walking through it. Because I know some of you're going to need some assistance. Some of us who are not overly tech savvy. And for those who I'm going to say this actually for those who are online, I think we can post it online as well, that you could take a survey as well. It's going to ask you a couple questions regarding this event. We hope that you can comment on there so that we'll know how to move forward going into the next year as we plan for this event. Alec, you're up there? Just let me know when you're ready to start live streaming. As you know, this is our first event, first of many health workshops that we'll be looking to do here going forward, and we're just trying to learn how to do it better and better each and every year. I'm having a good time with some of the information. I know I heard the ladies over here. You guys enjoying this information that you're getting? I know we did on the other side. Certainly, we were pleased to have some great speakers for the men in reference to mental health. Elliot, whenever you're ready, you can start us up. In reference to the men dealing with mental health, and just now we were dealing with various illnesses that we are affected by as men, and Sean Bright did an excellent job in terms of providing us that information regarding that. We appreciate him. We also appreciate Angela Ramos, who came and dealt with mental health on the men's side. So certainly we appreciate that. So that we don't leave out our people online, I'm going to pause for a minute. All right. Welcome back for those who are online via YouTube and Facebook. We appreciate you tuning back into this great event. We know our numbers are big online right now. I guess they were scared of the little bit of snow and held them back. But nonetheless, we are here and we're in effect, and we appreciate you all who have bring like living long and healthy. Amen. Nothing like living long and healthy. It's critical. As mentioned before we went online, we want to thank all of our speakers who were on the men's side and the women's side who did great jobs. Rachel Helly, Dr. Rebecca Young, Angela Ramos, and Sean Bright, all of which we dealt with both men and women subjects. We appreciate them. Now we move into the next subject and the next session that we have. This one. Now we should have had a packed house for this session as well. When it comes to obesity and the diseases that are strong from there, and dieting and eating right, and working out. Amen. And nonetheless, we have a more than capable a brother who is going to speak to us about these serious and important factors in our lives. And I know him personally because he trained my son. And I watched him as he trained my son, both physically and the advice that he gave him from a dietary standpoint. And I, in the back, so I didn't have to pay him, I kind of picked up some stuff myself, and I just paid him. No, but he's a really, really good brother, well-known brother, and he's local here in Newark. Alan Watson is his name. And I just want to give you a little bit of background of Alan Watson, who he is, and his expertise. Alan Watson is the CEO of A Game Training, LLC, located here in Newark. He is a all sports performance enhancement specialist. He's also an elite basketball trainer for those who are in that arena, and amongst other sports as well. Alan has over 18 years of diverse athletic and fitness experience, including 8 years as a professional basketball player himself. Amen. 11 years of service with youth basketball camps, and 10 years administrating and private and commercial personal training services. Alan tailors his training programs to each individual and clients. All A-Game training programs are available year-round. Alan has experience in training youth, teens, senior citizens, so it's not just the young ones as well, and those who are not senior citizens. He's also an expert in boot camp, weight loss, strength training, conditioning, non-athletic training, and general overall fitness. Without further, he has a number of different certifications, the National Academy of Sports Medicine, movement correction exercise with Reebok, youth strength and conditioning with NASM, and the list goes on and on and on. And as mentioned, he'll be dealing with obesity and disease, as well as some of the other things tied to that. So without further ado, the next person you will hear that will be talking to us will be none other than Alan Watson. Let's give him a round of applause.
You want me to come up? You want me to come up? Yeah. Hello, how you guys doing today? Good. So, again, my name is Alan Watson. I am I don't like to call myself a trainer because today everybody's a trainer. Because you could just go on YouTube and search this and that. So I like to call myself a tactician because I'm very tactical and strategic on how I do things and achieving goals, whether it's a beginner kid or as a non-athlete such as yourself, or NBA athletes, NFL, whatever it is. I'm very strategic on it and very tactical on how I do things. I'm also a business owner, A-Game Training, but also we own vegan restaurants, also a water bar. 4 of the restaurants are on Central Avenue, 547 Central Avenue, where we have healthy food, and then we have one on Clinton Avenue called Plants and Poets. But just to give you an idea of all the stuff that I do with that. So the topic was obesity, which is amazing, something that, is very dear to me. I deal with a lot with my family. Our community, we lead in high blood pressure, cholesterol, diabetes, obesity, due to our intake. Some people say, oh, well, it runs in my family. My mom had it, my grandmom had it, but I think that we just adopt we adopted the eating habits, the same eating habits. And I try to get that message out. We need to change, make some changes. So I'm gonna give you guys a lot of information on changes, exercise, and stuff like that, okay? So first question, do you build a house from the roof to the basement or the basement to the roof? Basement to the roof. So for me, and again, it doesn't matter. I have beginner all the way to the highest level, which is NBA, NFL athletes, right? So who are supposed to be the physical specimens, right? So I say the same thing. You build the house from the basement to the roof. Your basement is your flexibility, your mobility, your stability, meaning your balance, your core, and your hydration. And I'll start with hydration, right? Hydration is something that was so underrated. We've been so conditioned to drink this, right? This is a bottled water, right? One of the most intelligent things on this planet, or two of the most intelligent things on this planet is the human body and water, right? How the human body works. If you eat something and your body doesn't agree with it, what happens? Throw up, or comes out this end, diarrhea, right? That's how intelligent the body, like, nah, this ain't for me, you gotta get rid of it. So, the same thing, when we drink this, we call this plastic water. This water, by the time this company put the water in this plastic, we don't know how long it's been sitting in that plastic. We get it, put it in the back of our car, sitting in there, absorb. So all that water is absorbing all these plastic molecules. And then what happens is, we drink it. We've been conditioned to think, hey, I gotta go to the bathroom. I'm going to the bathroom all day because I've been drinking water all day. We have to change that mindset. The body on the inside is like a sponge. So when people come to my water bar and say, hey, drink this water, come back, see me in a week. They come back like, oh, wow, my stomach went down, my skin, like, it's just glowing because my energy level, that's because when they drink the water, so when I fill it up, you're gonna see the water, it looks like how 7-Up looks. Those bubbles, that's the oxygen. Water's supposed to give us oxygen, flush our digestive system, lubricate your joints, your muscles, your organs, your hair, your skin. So when you drink the good water, the body is like, your skin is like, oh, let me get some. Your kidneys, let me get some. Your lungs, everything is pulling at it, so there's nothing left to come out. So when we drink this, the body's like, I don't know what this is, so it's gonna get rid of it. So we're peeing it out. So a lot of people carry excess weight, especially in the tummy area, because they're eating when they're really thirsty. And then our community, so let's just say we eat, I don't know, Wendy's. So we'll eat Wendy's, and then, so it's no nutritional value in it, none with, like, zero nutritional value in it, right? So now, and then I say, I don't know, we eat pizza a little bit later on, no nutritional value, and we clogging our system up with mucus from the dairy, and then we drinking the plastic water. So the body's like, oh, please help me get rid of this stuff. And then we're drinking the plastic water, and the body is like, nah, that ain't it. And then, but your mind, you're like, well, I'm drinking, so I'm probably hungry again, and then you eat, and then it just piles on. You stack, and you stack, and you stack, and you stack, and the body's like, come on, help me. It's calling me like, and you're like, well, I'm thirsty again, you know what I mean? And then what happens? Ailments come. It's the same way our car, but the car, when you're driving your car, it doesn't just conk out. What happens? A light comes on, and the light's like, check your engine, right? It gives you a warning, it doesn't just go out. So the same thing, stacked days, eating bad, no hydration, eat bad, no working out, eat bad. So that stack, and then what happens? Oh, shit, my heart, yeah, I don't feel good, or I'm dizzy, or my back, right? It just adds on. So this hydration for me is at the top of the list because it is so important. We are water. We come from water. We're not that. So we're 85, 90% water. You have to hydrate in order to function. So the good water guarantee, I give people an experiment. I say just for 1 week, no plastic water, just get glass. You drink from glass or stainless steel, right? See how you feel. Digestive's gonna be different. Energy level is different just from the water. We didn't even do no working out yet. Just hydrate. 90 to 95% of the people, I would say, are dehydrated. And that's the start, yes. I'm sorry. Good.
What about if you boil your water?
I think I wouldn't say it doesn't help. If that's your only option, I wouldn't say it wouldn't help, but I would say try to, you have places like Whole Foods, and they have the same thing. So you could get a glass jar for $3.99 instead of getting a case of the bad water, right, for $3.99, $4.99. Hey, let me invest in my health, and let me go to Whole Foods or Trader Joe's, and let me just get, even if you get 3, even if you do 3 days, I'm so I don't even know how to explain the emphasis. I can't even put enough emphasis on the importance of the plastic bottles. This has it's nothing in here. Nothing that it doesn't benefit. It's just, I'm thirsty, it's wet, that's it. Same thing with the food. We could change the fast food mentality, and they flood us everywhere we go. Fast food here, fast food, this fast food. It has no value, so we've been so conditioned to eat like I'm hungry, and then I'm full. And then you're sluggish, like, oh, I'm tired. That's like putting gas in your car, and then your car putt-putting. You're like, damn, I just filled this joint up, right? Your food is your fuel. So if you're sluggish, that's a sign. That's when I say we adopted the habits of our grandparents. Thanksgiving, we eat turkey, stuffing, mac and cheese, potato salad, all together, and then we like, whew, we're not. So we have to change those. We have to change them because we are leading in every category. It's just a fact. I'm not making this up. This is a fact. We lead in everything. So one, hydration. Try it. Glass, stainless steel. Yep. Another question?
Yeah, one more.
Okay.
Okay. I just want to know, they have a new product.
Okay.
It's your water. This Japanese scientist came up with it, and they have it in a glass jar or a bottle or a device, and it kills the toxins.
Oh, I think I might have seen. So it's like a little mini jug, and when you put you could put like faucet water in there, and it's supposed to. Yes. So I've heard of it, but I've never used it, and I can't really say. So what you can do is you can go to CVS and get these things called pH strips, right? Probably like, I don't know, depending on the size you get, but it'd be $5. But what happens is you get the strips, and when you take it out, you can put it in your water, and then it's going to tell you exactly, this is acidic, or it's spring water, or it's alkaline water. It'll tell you on the strips. So that if I had that, that's what I would do, just to be on the safe side, because I never used the machine. You're welcome. So I was saying the fast food. So if we could change that, that would be like, that food has no nutritional value to it, right? So now we're not hydrating, we're eating fast food, and then we're not working out. So to me, you feel good, I can do whatever. So it doesn't take a full workout. I say, hey, when you wake up, just start doing dynamic stretching. Anybody know what dynamic stretching is? No? Dynamic stretching is stretching while you're moving. So that means like, let's say all right, we're going to go do a morning walk. You're not going to just wake up, boom, and just go walking. What I do is, one, you do your stretching, I'm just pulling while I'm moving. So you do this stuff, this, scoop, but you're doing it while you're moving. So that's getting your body prepared for what it's about to do, right? So I tell people, even if you do, it takes probably 3 minutes. When you wake up, you do your dynamic stretch Before you go to bed, you do your dynamic stretch. That's only 6 minutes. 6 minutes in 24 hours, and that's how you start. Well, I will guarantee you, you get the glass of water, you do your dynamic stretch, alone you're gonna feel better. So it's just like every day, the routines, if you're, I don't know, a bus driver, and you're in this position 60 to 70% of your day, what do you think is gonna happen? My hip flexors are weak, and then if my hip flexors are weak, these muscles work together. There's always a muscle, and there's something that works with it. If it's my hamstrings, my glutes work with it. So if I'm sitting all the time, I can always tell when it's somebody that's a bus driver or a secretary, somebody who's sitting at a desk, because their arm, when I do assessment, they're always like this, because they are like this. So they walk around, they're like, kind of like this, and they don't really realize it because every day it's just normal. They're just in the routine. So they sit, and then, so I say, hey, just do the stretch. 3 minutes. Guarantee you, you're going to feel better because you're not doing anything. So if you just, stretch my hamstring, breathe, 1, 2, 3. And you do that, week 1, week 2, week 3, you're like, oh, I feel kind of good. All right, let me get 3 more bottles of this water, and you're gonna feel better. That's a guarantee. Again, I work with little ones all the way to pros. The same, nothing changes, because the body is the body. And if we're not drinking water, and we're eating bad food, and we're not even stretching, forget working out, just stretch. The body is designed to move, right? Movement, everything, move, arms, head. You're not an athlete, but you want to be able to, hey, you see your grandkids, hey, how you doing? You want to be able to do those things without, right? You want to be, it's called functional. You go on vacation, you want to, I got this, let me put this up here. That's a functional movement. Life, you just living life, but you want to do it in a way where I feel good. In the body, the only thing when I wake up is only one job of this body. To make you feel good. I just want to, whatever you want to do for the day, I'm here to help you do it. And the body only going to act on what it intakes. If you giving it, if this is a Rolls Royce, you can't put regular gas in a Rolls Royce. It's not going to function, right? So we have to start at least little steps of changing. Like, this is my Rolls Royce. I want to make sure it runs. Make sure everything, my fluid, got water fluid from my windshield wipers, in case it rain. I want to got gas, got the right gas. That's it. Function. So another thing, it's a few changes that I like to give out that I think are super, super important. Again, I'm vegan, so we don't eat flesh. So we eat, everything that we eat is made from grains, plants, all different type of plants, right? So, again, that's a major jump. I get it. It's not like, okay, I eat steak, go vegan, right? But you can make some changes. So I would say, hey, let's say this week, you know what? I'm going to eat, I don't know, beef one time, or no fried food for a week. I'm going to just eat grilled vegetables, salad, and whatever, a grilled fish. And that's how you make changes. So it's not realistic to say, all right, right now, all right, let's go vegan. No, you're gonna set yourself up, you know what I mean? But the key is make small changes, a little step at a time. So that little morning stretch, that's a little step. Getting a glass of water, that's a little step. And then the other little steps, you say, you know what, instead of that, I don't know what that salt is called. I remember as a kid, what's the red and the white salt? The two-tone. And then the lady with the umbrella salt. Yeah. So, Yes, dime, yes. So instead of this, you know what? Let me go get some pink Himalayan salt. Or let me get some sea salt. So boom, I switch my salt. That's a step. And then let me switch my sugar. So instead of that, I don't even know, domino. Instead of that domino sugar, hey, let me get some agave Let me get some coconut sugar. Let me get date syrup. So I like to drink tea. Cool. Let me put some date syrup in there or agave in there. That's sweet. The same thing. Same sweetener, but it's just natural. So you change your salt, change your sugar. Your oils, very important. The worst thing you could put in your body is canola oil. Like I don't even think nothing like canola oil is the worst thing that you can actually put in the body. And when you're shopping, and you're in the grocery store, two things I like to do with my clients. First thing you look for is canola oil. Probably if in ShopRite, I would say 80% of the things I might be being lenient. It's going to have canola oil in it. You know why? Because it's cheap, right? It's cheap. So canola oil you can put in the car. You can look like you can research it. Hey, how bad is canola oil for you? Or what are the things canola oil can do outside the human body? Like, really look it up. Terrible. So instead of cooking with canola oil, you change. You say, hey, I'm gonna get some avocado oil, or let me get some. You got a grapeseed oil. If you're frying, right? If you're baking, you say, hey, I got almond. They got almond oil, safflower oil, but you don't want vegetable. You don't want vegetable, peanut, or canola. Olive oil is designed to be on salads. So what happens with olive oil is, a lot of people think, oh, I'm doing healthy, I'm doing a healthier thing by using olive oil. But when olive oil reaches a certain temperature, it becomes a chemical. Because olive oil is designed, you make a fresh salad, you put olive oil on it. You shouldn't be frying or grilling with olive oil. Right? Mm-hmm.
What about vegetable oil? Vegetable oil.
Vegetable oil? Nah. Vegetable, all of those, terrible. Terrible. And you thinking because it's vegetable or it's peanut. Olive oil, avocado, grapeseed, safflowers, okay? It's called safflower oil. Walnut oil, stuff like that. The best thing. So you change your salt, change your sugar, again, change your oil, and then another big piece is your pasta. Pasta, regular pasta. So I have clients that's like, I just had a pasta salad, but my levels went up. Because regular pasta turns into sugar, you know? So I have them switch their pasta. You could have chickpea pasta. You could have kamut pasta, which is a grain. You could have spelt pasta. All those things are grains, and it's digestible, right? That's what you want. You want to give something that your body is going to take what it needs and then get rid of it, right? So you change your salt, change your sugar, you change your oil, you change your pasta, and then another one of the worst things that's there when I say with canola oil, I would say neck and neck, is dairy. I would say, and I'm vegan, I would say continue to eat. I would rather you eat the meat than to drink milk, cheese, because what happens is the body, what dairy does to the body, we're one big flow. Like, our body is, everything is a circulation, flow, right? Everything flows, right? What dairy does, it would be like, so let's say this is the flow, and it's got to flow through, right? What dairy does is build mucus in the body. So, right? And now this is trying to flow. Your system is trying to flow, and it's like, kind of, I can't, it's kind of cloggy up in there. So that's what cheese and milk and cream cheese and all that stuff does to the body. It slows down the circulation, and it builds mucus in the body. So during 2020, during the COVID time, we healed so many people, and how I break it down to simple terms so people can understand it. So let's say, all right, where your body is fighting meat, right? Damn, they say it takes 2 weeks or so to really break down meat. So boom, my body's fighting meat. Oh, okay, meat, I got you. We going toe to toe with the meat. And boom, here comes dairy. Oh, wait, all right, so now I'm fighting meat. Boom, I'm fighting dairy. All right, I can hold my own, I'm fighting. And then, oh, okay, here comes sugar. Oh, what? Sugar, sweets, all right, now I can't. Boom, right? So I'm fighting sugar, I'm fighting meat, I'm fighting dairy. And then here comes a virus. The virus like, oh, look at him. He ain't worried about me. I can't be. The body is, he got to focus on that. So now I could just go wherever I want. And I could just hang out in this body. Oh, and then you continue to eat processed food, no exercise. And then, right, he's like, oh, I'm in here chilling, right? So how you change that? You got to detox. So we make a detox. All right, you want to get right. You don't feel well. You sure you're ready for this? You got to be ready. I'm ready, Al. Boom. Let's detox. Again, this is one big what? System. That's flow. So what you do, I make them detox, cut everything out. You got different detox. You got a master cleanse. We got juice detox or herb detoxes. But you have to eliminate eating because you got to give your organs a cell. You got to give your organs a break. It would be like, I like to, again, break things down to simple terms. It would be like you wake up, get in your car, go wherever you're going, leave the car on, go do what you do, boom, go to work, come back, your car's on, go ride, get home, leave the car. The engine is doing what? Working. Non-stop, working. You're never giving it a break. Our bodies are big, but our organs are like this. This little. It's little, and it's non-stop working. You eat meat 2-3 times a week, beef, pork, all that stuff. That system is like, all right, I'm working. They hit sweets and all that, so they're working. So what a detox does is a detox allows your organs to chill out, right? And you flush and you reset. When your phone, sometimes our phone is moving slow, you're like, damn, what you do? Turn it off and reset it. That's what a detox does. You reset your system, your cells, your organs, and break, and then that's what happens. So during that time, I detox them, and then I'm saying, all right, now you reset. So now we're going to just eat fruit. Fruit is the number one, like, when you want nutrition, there's nothing better than fruit. We're going to fruit you to death. And then they start getting live, and then when we get the fruit in them, then we say, all right, let's get some herbs, right? Get some herbs for your cells, some herbs for your joints, right? To feed. And now you're just getting all positive energy into it. And now, when you go back to eating, they're like, oh yeah, no, I want to change some things because what I went through with that. Very important. We've been conditioned. We wake up, we eat bacon, egg, cheese, grits, pancakes, right? That's really how we eat, right? It's like we just been so bamboozled, you know what I mean? And you should wake up, and the first thing you do is drink some water, because your body is in deep. It's called breakfast. It stands for break fast. When you're sleeping, your body is fasting. How do I break my fast? With water, because your body is. How we are designed, every human being, the body is. When you wake up, your body is in detox, it's in cleansing mode. That means it's trying to get rid of everything that you ate, right? That's how we are. But what happens is it gets clogged up because we wake up and we eating bacon, egg, cheese, grits, and pancake, all that type of stuff, when you really should drink water. 1, to hydrate. 2, you want to eat berries, blueberries, strawberries, blackcurrant, raspberries. Because why? Those are antioxidants. So now you hydrate it, 1. 2, you got antioxidants, which, my body's ready to fight whatever. That's how you start. And then 3, you should have walnuts. Walnuts, 1 is number 1. Walnuts, anybody know, if you had to think of anything in your body that a walnut looks like, what do you think it looks like? Huh? The brain. Most food that we eat looks like what it does, what its purpose is. Walnuts is called brain food. And we forget the brain. I'm hungry. We eat the boom, just get full. The first thing you do, it's nothing more important than this. Everything functions from this. So why not, one, you hydrate it. Brain is water. Research it. The brain is water. Wake up, hydrate it, fruit, berries, get the antioxidants, and then you eat brain food, which is walnuts. That's the most important thing you can do. Whatever you do after that, your body is ready prepared for it. But you can't wake up, eat cereal, milk, bacon, egg, and cheese. For lunch, I got pizza. For dinner, I'm eating steak. You know what I mean? It's too much for the body. So we talk about obesity. That's where it comes from. We're stacking, bad stacking. And then this thing is going to do what? It's designed to go which way? Out. It's going to go out. That's just, right? And then if it's going out, you're not exercising, pain. And then, and then once you go to the hospital, what you think they're going to say? What they going to give you?
Medicine.
They're going to give you medicine. That's a guarantee. It don't matter. They're going to give you medicine. Something. You should take this. And then how the brain works, once she's like, I need this, we're not going to say, nah. They're never going to say what I just said. Hey, change your diet, exercise more. Very rarely they say that. They're going to be like, take this medication. And once you take this, I just don't believe. I have family members. I'm just like, so you got to stick yourself for the rest of your life? How does it help? If it's help to help you, I have to take it for the rest. It's not helping me. Usually, if something goes on, what happens? I put a Band-Aid, and then eventually what happens? It goes away. You don't need I don't need the Band-Aid for the rest of my life. No. So we have to be more mindful of the food is the medicine. The food is the medicine. Guaranteed. Everything we need is here. Fruit, the herbs, the vegetables. Even more important than this is crazy. More important than the H2O, which is the water, is who knows what H3O is? H3O is what you get from the fruit. So you could eat a watermelon or juice of watermelon is more nutritional than the water, regular water. You could juice a cucumber and hydrate your body for the day with one cucumber. One cucumber, exactly the hydration that your body needs to function, one cucumber does it. So, or coconut water. People are like, I don't like coconut water. I said, listen, I get it. Just add. Get your intake. You make smoothies, instead of regular water, you use coconut water. Because everything you want to put in this Rolls Royce is beneficial for the car to function right. So those changes are super important. You will reverse anything that you have. I don't care what element. It could be high blood pressure, cholesterol, diet, whatever it is. It can be reversed. It's up to you. It's your control. It's your car.
How long do you detox for?
Depends on what a person's issue is. But I would say, from beginners, I would say a good one, 3 to 5 days. 3 to 5 days. This is how I usually start people. I'll go, all right, let's do, and it depends on the person. Because some people, I can say do a master cleanse. A master cleanse is basically, we call it a lemonade. It's alkaline water mixed with cayenne pepper. Before I do it, cayenne pepper is one that you should put cayenne pepper on everything. Cayenne pepper is a natural cleanser. Alone, look up the properties of cayenne pepper. A natural cleanser, and it's good for circulation. So again, the lemonade is the water, cayenne pepper, grade B maple syrup. Not Aunt your mama, but grade B maple syrup, 100% maple syrup, and fresh lemon, organic lemon, or key limes. So you have the option. You can use key limes or you can use lemons. But that's called the lemonade. So that's a master cleanse, and that's like, I don't want to say it's brutal. It's very, very challenging because a lot of people, I'll say, that's your food. Everything that's in that lemonade is everything that your body needs to function, right? So what happens is once you start drinking, so I say day one, people start day one. They're like, oh, it's not bad. The body's like, all right, it's changed, different. Day two, I tell them, I say, if you get through day two, you could do it 5 days, you could do 7 days, you could do 10 days. But most people break on day two because it's like your body saying, all right, maybe he was just busy today, but I know for sure he's going to feed me tomorrow. And day two comes, and you wake up, like, that stomach is like, and then, and you're going to go through migraines. Who can tell me why they think you're going to go through migraines? Well, more so withdrawal. You're going through withdrawal because your body is used to the sodium and the salt and the sugars from all the foods that you eat. So the body, all those fast foods, that stuff is addictive. Your body, sometimes you just be like, man, I could go for some McDonald's fries. It's addictive. They have chemicals in them that make it addictive. That's a fact. Like, and a lot of that stuff is in there. You could research it, but it's probably like this big. So you eat it. Yes. One more time. I'm sorry, say it again.
Would you make any adjustments for someone like myself? I'm a type 2 diabetic. Would I have to make adjustments to that or pare it down a little bit?
Yeah, I would, because you can't do, I would probably change I would do juice. I would do a juice. I would do juice, water, and dry. But I'm gonna get to those. I'll explain to you later. I'm sorry.
So when you talk about dairy, particularly like you said, milk and cereal.
Milk.
So you talk about cow's milk and alternatives that you like.
So the alternatives would be like oat milk, almond milk with no carrageen in it, right? So oat, almond, walnut is excellent. Hemp milk is really good. I would say those four on the top, yeah. But you want to make sure it's not, and you always want to look for in those because even though there's a lot of the front, we have a thing. The front is entertainment, the back is educational. So when you read, if it's a whole bunch of, okay, what is it? Oh, oxy, dolly, molly, polybot. Oh, Motrogen, extra. It's like, what is all that? I don't know what it is. It should be simple. If you get, it's one of a good almond milk. It's called 3 Trees. 3 Trees and Milk. It's spelled MALT is what I drink. It's milk. It's probably this big, and it's probably like $7, but it's very beneficial. It has no gums in it, and you don't want the carrageen or the gums in it, and you don't want any added sweeteners, right? You just want it as is. That is. Oh yes. Okay. Coconut milk. Yes, coconut milk is excellent as well. Yep. Those changes are. I mean, again, dairy is like at the top of my chart. That and the canola oil, yes.
1 second. Mr. Brown.
Yes, the plant-based milk, that would be the almond, the coconut, hemp, oat, yep. Walnut is also good, walnut milk. Those are all the plant-based milks, yep. Yes.
Is it okay to drink the alkaline water in the plastic? Because that's what I like. No.
No, plastic. Plastic is no bueno. You want to drink from glass or stainless steel.
You're hurting a lot of people. You're hurting a lot of people today.
Yeah, and you'll see, and I'm going to tell you something. Our community, so I look at it like, from my generation, it's a marathon. I got you right there. Okay, So it's been a marathon. We wake up from kids on Saturday morning with cartoons and what go together. Cereal, milk, right? I mean, that's how everything has just been propaganda to us. And they put, I don't know, Muhammad Ali with a mustache and say, milk it does your body good. Oh, Muhammad Ali do it? Oh, we gonna do it too. And that's how it works. And then, oh yeah, the beef, you need protein. To give you beef, give you protein. Oh, it does? That's what we do. So everything was marketing and propaganda, and it was a marathon. So all of my friends, a lot of my friends, they all dealing with those ailments. And I say it just was a buildup, year after year after year after year. So now I'm like, you gotta change how we think and how we eat. We overeat, right? And that I didn't even count with the fighting, the meat, the sugar, the dairy. Now let's just say, throw alcohol in there. That's a whole nother, right? The body is like, oh, you gotta help me out. You're killing me. And the only purpose is to make sure we are well. It doesn't wake up and say, oh, you know what, I'm gonna make his back hurt today. No, it just wants you to be healthy, fighting, you fall, scrape, it's gonna heal it. The body is amazing, it'll heal itself. You don't have to do anything. So if you're going through something, people are in situations and they're like, I wanna eat. No, you're in a situation, let it heal itself. This thing will heal, that's what I'm trying to tell you. The most intelligent thing on this planet is the human body. It has defense mechanisms. Be like, you could go somewhere and be like, I don't know, it feels like something happened. That's a defense, that's a mechanism. This thing is nothing more intelligent. Everything that's created is based on how the body works. So we just have to take care of it. So if you have ailments and you don't feel good, it's your check engine light saying, hey, you need an oil change. You gotta change this oil. You can't, it won't change unless you change. You gotta change something. Some people just, well, my grandmother was raised on pork and she lived to be, I hear you. My grandmother was fat back the whole time, right? But you gotta look at, right? You gotta look at back in the day when they had cows and pigs, they would play classical music. And then the pigs just calm and walking around there, and then they rubbing it, and then it's like, now that joint is like slaughter. All that stress from that pig, like, oh my God, that's all we eating. So you add the stress of the food to, damn, my job, I don't know how I'm gonna pay this bill. And that's stress on top of stress, on top of that. We just piling on. And then we do that and we think, and we don't make any changes. Like, damn, what do I need to, so change, you know what, I'm gonna cut back fried food, you gotta make some changes. That's like essential, yeah. Yes, go.
You gotta get back to water. I drink a lot of water.
Right.
So now I'm so upset that I'm drinking out plastic.
Yeah.
It's got glass.
Glass.
And steel.
Stainless steel.
So what you're saying is I'm running water out of my faucet into a glass, or like what am I doing?
I don't even want to be the bearer of bad news, but I don't even faucet. So faucet is like every city. So put like this, right? So we have a water bar. What I learned through the water bar, once we bring in a specialist, every city has a different issue with their water. So like West Orange, their issue is, which is disgusting, but so their issue with their water is the chemical that the firemen use to put out fires that's in that water is in the West Orange water, right? So Newark has always been a lead thing. So you see what I'm saying? Every city, South Orange has a different thing. So depending on where you live, in Irvington, I mean, it's just on and on. But so faucet water is I would probably I don't even know. I don't even know how to. I was almost about to say I would drink this before the faucet water, but the faucet water, no. You have to, yeah. Either worst case, like the young lady said, boil it. But I would import my water, get glass or a filtration system, stuff like that, because the water is again essential. Yeah, but you don't want this. And I get it. You'll be thirsty and it's just wet. That's it. But when you talk about feeding it, it's not feeding your cells and your joints.
No, that was the question I had. You saying do not buy bottled water.
The plastic
So where
water.
would we get the water from was my question.
Where would you get it from? You have places like, well, I would say everybody knows Whole Foods. And Whole Foods is, I would say, more expensive than ShopRite, But I can tell you that it's less expensive than the doctor bill.
Well, what
Right?
kind of water would I get?
So the top waters I would say is Mountain Valley. Mountain Valley comes in a green bottle. I can pull it up. It's Mountain Valley is one. Two, I would say Saratoga. It's like a sexy blue bottle. Three, I would say is Arcadia. It's an Italian water. I want to say it's a clear bottle, but it has orange writing on it. You also can get Voss. Voss was really one of the first. Oh no, I'm sorry. It's one more. Starski's. Starsky is a clear bottle. It's Starkey. They're one of the oldest springs in Idaho. So Mountain Valley, Saratoga, Starsky, Arcadia, and Voss. Voss they started out all glass, but now they are, they make plastic. It's BPA free, but.
So all these you just named, when I go to the store, I'm going to buy them in a bottle.
Yeah, it comes in they come in cases. Well, now actually they just start making like this size. They'll have a case and it's of this size because they usually come like probably like this big. So the case is a little heavy. It's like $32 for a case of I don't remember 12 or it's maybe 12. Can't remember exactly how many. But it is heavier. But they now make the smaller ones. No, you have Mountain Valley. It's a green bottle. Saratoga is a sexy blue bottle. You have, what's the third one I said? Starsky. Yeah, it's clear. It has like a maroon label. Arcadia is clear with the orange. And then Voss. Yes.
What about a refrigerator filter?
Refrigerator filter or a water filter? Yeah, great. Water. And so once you get on this journey, right, and you start making those changes, right, you make another change. You say, hey, because your biggest organ is your head, right? Now I'm showering, that same water that you're trying to avoid to drink, when I shower, this is still getting in my system, right? So then you eventually, hey, I'm gonna give me a shower head. So you want the same filter that you want to get to drink, because you got internal and external, still organ, still pores, right? So if I shower, that same filthy water is getting into my system as well. So you eventually want to get a shower head. Yes. What is it? Artesian water. Artesian water, okay. Mm-hmm. I think so. Like it's spring water, but I still think it's a part of a propaganda because. We look at Fiji, it's a beautiful, colorful bottle, it just looks to be healthier, but it's still in a plastic. Then I'm gonna tell you the newest, Essentia had a great marketing. They had the strip in the back, highlighted 9.5 alkaline water, so everybody's like, oh, terrible. That water is terrible. Yeah. Oh. Filtration. Yeah, but yeah. Mm-hmm. Yes. Yeah. Mm-hmm. Yes, filtration for sure. Yeah, like they have them now, portable. They have them portable now. So yeah, that's that's your baby. Like I would have my own little bag. Like that's the water is everything. Mm-hmm. So yeah.
I'm taking two last questions. Sister Taylor and then Sister Love.
So can you speak to artificial sweeteners? So many of us try, certainly avoid sugar, but then we use artificial sweetener. There's been a lot of controversy around them.
Like stevia?
Monk fruit, like stevia equal, but monk fruit has entered the picture as a good alternative.
Yes.
Is that true?
Monk fruit, yeah.
Okay.
Monk fruit is good, it's natural. You have agave. So if you're a tea drinker, coffee, like I drink mushroom. I love mushroom. Agave sweetener or coconut sugar, natural. You got date syrup, stuff like that. Those are all really good ones. Mm. Yes. Perrier water. Perrier is good. Yes. The sparkling water. Yes.
And plant-based meat.
Plant-based meat. You have to be very vegan and plant-based is the new fad, right? Everybody's doing something plant-based. So you have to, again, the front is for entertainment, the front label, but the back is for educational. So you always want to read, and when you see, lab made, or it's going to tell you. So one thing they always going to do is they have to, by law, tell you. You got to read the fine print, read between the lines. But a lot of the plant-based meats are not good. Yeah, a lot of them. So you never want to do, you remember Burger King came out with Impossible Burger? And everybody's like, I'm going to get a vegan burger, Impossible. You might as well eat the regular burger. Because the chemicals, what they did was they put a bunch of chemicals together to get the flavor. And you guys probably wouldn't even believe, like a lot of things, what they do to, for the coloring of it. Because people are like, it has the red, like, it looks like it's real meat. I mean, they use, it's called, again, you can research this. This is not something I make up. But a lot of the fast foods use they call human fillers. So what they do is to bind the patties and stuff, they use remains. So you ever see a tragic accident on, I don't know, the Parkway when it was like bad, things were amputated. A lot of those companies, that thing where it's like this person is done and arms over there, legs over there. Again, whatever I'm telling you, you can research it. A lot of these fast foods, they're using human remain as binders. This is a fact. So that they're using some or horse. There's so many articles that I have that I like to show people. Now that I'm thinking when he asked me, you want to show? I should have, like Burger King, they came out. They had to admit, we're now using, they didn't say fully beef, we're now using half beef. What was you using before? Like, you know what I mean? So, you want to stay away from as much fast food as possible. Like, it's really not, they really don't. The best song Michael Jackson said, All I want to say is that they don't really care about us. It's real. They don't. It's about making money. It really is. And we think it's fast, convenient. Everything now is convenient. Quick. The fastest way to get obese. Them fast food, the fastest way for diabetes. You keep being fast. No. Take your time. And the last thing I'm going to leave you guys with, to go along with that, which is very important to me, is grounding. How many people know what grounding is? You ever heard of grounding? No. Grounding, nothing to do with food. Like grounding, so meaning like we wake up, we're 90% of the day, we're in socks and shoes, right? You have to, it's for me essential to take some time to, it's called grounding, where you, if my phone gets low, what you do? You put on a charger to get what? Juice, energy, right? Natural energy is barefoot. Take your shoes and socks off. Put your feet in grass, some soil, some sand. That's natural. You don't have to pay for it. That's a natural. The earth operates on 8 hertz frequency. When you're feeling down or low, or this is not just go put your feet in grass, soil, sand. That's one. Natural. 2, sunbathe. Sunbathe meaning when that sun is out there shining, sometime just go and stand, just let that sun, that's a natural energy. Natural. You don't have to, that's how electric the body is. Just go and get some natural sun, right? So you ground, you sunbathe, and meditate. Even if it's, I don't know, 3, 5 minutes. We deal with a lot every single day. I gotta do this. This is how life is. So from the time we wake up, we running, right? You have to find some peace. And whatever is going on, we have issues, bills, family stuff, whatever. It could be 3 to 5 minutes. When I go speak to kids, I'm at Westside High School. And they're like, what? Grounding, they don't know. Try it. They do it, they meditate, and they're like, damn, I really feel good. It's because it's an escape for whatever that time is. It's an escape from whatever you got going on. And I know you spoke about mental health. That's a part of mental health. You have to take care of your, this is it. You know, you get one, you don't got no extra one, like, oh, let me get that extra one over there, right? So the food, the hydration, all those things, the nutrition, you have to ground. Take some time to ground, sunbathe, get that natural energy. I think that's it.
This was amazing. Amazing. Give Al a round of applause.
Thank you.
I know.
Thank you.
I know there was a lot more questions. Al, do me a favor. Tell them, and we'll circulate your information as well. He's local. He's right over by Westside High School.
Yeah, so Central Avenue. So we have Blueberry Cafe. Blueberry was created. Anybody heard of Dr. Sebi? Yeah. So Dr. Sebi he's a healer. Cured AIDS and all this stuff. He was in battles with the U.S. and they trying to figure out how you do this without medicine and this, that, and the third. So Blueberry Cafe was inspired through Dr. Sebi. So anything that you get in Blueberry, first and foremost, anything that in any of the stores is one, organic. Nothing. Everything we have is organic. Everything that the food comes in, which is super important, because we've been, again, eating. We go to Chinese food, get that hot food put on styrofoam. That's a chemical. It's not designed to go to the body. So everything that the food comes in is sustainable. Sustainable meaning whatever we have, whether it's a napkin, a fork, you can put it into and it's going to dissolve back into where it came from, right? If we have anything, we're anti-plastic. The cups that we have that are plastic are made from banana peels. So you have to Oh, so that's what I'm saying. So Blueberry Cafe was inspired through Dr. Sebi. So anything, it's more geared, I would say hardcore vegans, because we're alkaline vegan. We don't eat like carrots, we don't eat cabbage, we don't eat cauliflower, those are hybrids, right? So Blueberry is that. Next door is Zucchini Bar. Zucchini Bar is where I get people, it's like I can get them to transition a little bit and try it through Zucchini Bar, because we got burgers, pizza, loaded nachos, tacos, we got chocolate chip cookies, like everything that your brain, you're used to getting, Zucchini Bar has it the same way where you wouldn't even tell the difference. And that's right next door. That's 547 Central Avenue, between 10th and 11th Street in New York. And next to Zucchini Bar, we created Magic Cones. Magic Cones is unique because it's plant-based ice cream. The base of it is coconut. It's made from coconut. So butter pecan, pistachio, strawberry, chocolate, it doesn't matter. The same ice cream that you like from Dairy Queen, you could get it at Magic Cones, but it's just healthier. And a lot of people are lactose intolerant. So you're gonna be there, people come from all over to get this ice cream, because it's like, damn, how did you get ice cream, butter pecan, and I don't have, lactose. So that's that. And then the last one on that street is called Aquafit. Aquafit is the water bar, and that was the raw. So you could get cold pressed juices, raw food, like we have plant-based sushi, stuff like that there. And it's a gym, but I rented the front of it, ironically, the front of the gym I rented to Dr. Sebi's son. So you could come there and get herbs. So in the front of the store, when you come there, you say, hey, I'm dealing with, I don't know, high blood pressure. You can come there and get herbs catered to a high blood pressure, cholesterol, whatever the case may be. And then the last one is on Clinton Avenue, on Clinton and Chadwick. You guys remember the old bank, like back in the day? Yeah, so it's now called the Jerry Gantz building, who's a famous artist from Newark. But we have a cafe in the first floor. It's called Plants and Poets. And there you can get burger sliders, you could get paninis, soups, and we named it after artists. So we have like the Naughty by Nature salad, we have the Patty LaMelt, the Whitney Houston hoagie, Chuck Berry smoothie, stuff like that. So it's the one on Clinton Avenue is called Plants and Poets. Plants and Poets, because we have, like on Fridays, we have, like yesterday, we had jazz, we'll have a live artist, we have spoken word, open mic. And it's amazing, it's a beautiful atmosphere, and diabetic friendly. You could get sweets, hey, I have diabetes, or whatever the case may be, we have treats that cater to. So.
Al, tell them about your training services and your consulting as far as.
Yeah, so I do training again I'm known with athletes because I deal with a lot of NBA and NFL type of athletes or high level basketball players and stuff like that, but a trainer doesn't matter. Like, if it's a body, I can train it. Like, and again, when I said I don't like to call myself a trainer, because I really went through the process. I studied, get certifications, where now somebody could say they could have a nice body, right? And then people are going to ask them, hey, you work out? So I'm going to start training. And they could go on YouTube. You could say, hey, I want to lose weight. They could go to YouTube, put in, and just go that way. When I really had to study and do this in years, and I played professional basketball in Europe for 9 years. Every year that I went there, I was getting certifications, studying. So that's why it's kind of like, I don't hate on how they do it, but it's just, I went through the process. Right? So, but A-Game Training is the company. A-Game stands for always going above maximum expectations. It's a lifestyle. My trademark is no off-season. Trying to think. You can find me at A-Game_training on Instagram, or Alan Watson, I think, is on Facebook.
That's good.
That's it.
Yeah. Outstanding, Jack. One more round of applause one more time.
Thank you.
wealth of information. He will be back. He will be back on multiple occasions. We need that information from him. So certainly check him out on the links that he gave you. Reach out to him. You want some consultation regarding the dietary. But more importantly, we recorded all this. So you can go back onto our website and rewatch a lot of this stuff and gather a lot of this information that he just gave us, which was amazing. I mean, I got to go home and throw everything out in my kitchen away now.
You can email me, alan.watson. It's alan.watson at gmail.com. Yeah.
Perfect. Appreciate it, my brother. Appreciate it. All right. So, as you know, we got delayed with this weather. So, guess what? They got some food downstairs, but nobody want to eat now, right? He done messed all of it. He gonna go down there and be like, you done messed this up, my brother. I mean, I know my people. You only messed this up for about 10 minutes. Oh, we gonna feel bad for about 10 minutes, then we gonna be all in again. Let me stop. So listen, it's 10 to 1, and we're a little bit behind, but we're gonna have to. It's some grabbing sandwiches out. It's some apples down there. I think some vegetable soup. No canola oil in there. So we're gonna go down there and grab something to eat real quick. I said about 20 minutes. Yeah, but 20 minutes. Grab, it's already prepackaged. Get something to eat, sit down, come back up here at 1:15. We want to get started. Yes, sharp. We have our next speaker. He's here. He's ready. He's going to give us some really, really good information regarding finding good healthcare providers, finding the information regarding the healthcare providers and some of the services that we need to know about. So let's break. As a matter of fact, what I want to do is I'm going to pray for the food right now. I want to pray for the food so we can go down there and grab it, eat, come back up here. We're going to start at 1:15 sharp. Yes, 1:15 sharp. It's 12:51 right now. Let us pray. Father God, we come to you at this time. Thank you, dear Lord, for this blessings that you have showered down upon us. Thank you, Father God, for allowing us to be here. Thank you for the wealth of information that we have received throughout this day, Father God. It's only because of you and your goodness, Father God, that we are able to receive this and able to be here. We pray for you. We pray that you bless the food that we're about to receive from the nourishment of our body, Father God. Thanks to the hands that prepared it. Thank you for the funds to purchase it, Father God. Just allow it to be of nutrients to us, Lord, if it be thy will. We just thank you. We love you. In Jesus' name, we lift this prayer. Let us all say, amen.